free CNA practice test with answers 180 questions 2026. Question 1. Stanley is a 70-year-old man who recently had surgery in a local hospital. His condition is stable, but he requires 24-hour nursing care. He is most likely to be: Option A, admitted to an assisted living center for rehabilitation and therapy. Option B, readmitted to the medical surgical floor of the hospital. Option C, admitted to a long-term care facility. Option D, released to his home with his spouse. The correct answer is option C, admitted to a long-term care facility. Admitted to a long-term care facility. Question 2. Mrs. Milton is found to be stable following her hip surgery and no longer needs daily nursing care. Mr. Milton can care for her at home, but she needs physical therapy to strengthen her hip and leg. The best option for her is to: Option A, be admitted to a nursing home. Option B, find an assisted living facility that offers therapy. Option C, return home and go to outpatient therapy. Option D, go to a subacute hospital. The correct answer is option C, return home and go to outpatient therapy. Return home and go to outpatient therapy. Question 3. A nursing assistant who works for an assisted living facility can expect to: Option A, spend most of the shift giving one-on-one care. Option B, have different resident assignments daily. Option C, take frequent vital signs. Option D, help with basic needs such as bathing, cooking, and cleaning. The correct answer is option D, help with basic needs such as bathing, cooking, and cleaning. Help with basic needs such as bathing, cooking, and cleaning. Question 4. Mr. Krieger has been able to take care of himself at home, but he has been forgetting to take his medications and occasionally wanders away and becomes lost. Because he lives alone, his family is concerned for him and wants to ensure that he is safe. The best option for Mr. Krieger would be to: Option A, hire a nursing assistant from a hospice agency. Option B, move into a community-based residential facility. Option C, have a home healthcare agency set up his medications for him. Receive daily skilled nursing care. Option D, move into a community-based residential facility. The correct answer is option B, move into a community-based residential facility. Move into a community-based residential facility. Question 5. Nursing assistants who work in a subacute care facility provide care for residents. Option A, immediately after surgery. Option B, who are medically stable but require 24/7 nursing care. Option C, who cannot afford a hospital stay. Option D, during business hours only. The correct answer is option B, who are medically stable but require 24/7 nursing care. Who are medically stable but require 24/7 nursing care. Question 6. The first step in refusing a delegated task is to: Option A, tell your immediate supervisor that you are not able to complete the task. Option B, document the reason for your refusal. Option C, determine if you have been trained to perform the task. Option D, inform the director of nurses of your refusal. The correct answer is option C, determine if you have been trained to perform the task. Determine if you have been trained to perform the task. Question 7. The entity responsible for regulating swing bed units is: Option A, the Health and Human Services Department. Option B, the Joint Commission. Option C, state regulators. Option D, either B or C depending on the location of the units. The correct answer is option D, either B or C depending on the location of the units. Either B or C depending on the location of the units. Question 8. Chain of command is: Option A, an approach that increases the risk of medical errors. Option B, the hierarchical form of communication. Option C, working within your scope of practice. Option D, used in the military but not in healthcare. The correct answer is option B, a hierarchical form of communication. A hierarchical form of communication. Question 9. It is outside the scope of practice for a nursing assistant to: Option A, help a resident eat dinner. Option B, insert tubes into a resident's body. Option C, offer emotional support to the resident's family. Option D, provide dementia care. The correct answer is option B, insert tubes into a resident's body. Insert tubes into a resident's body. Question 10. Respite care facilities are regulated by: Option A, state governments. Option B, both the state and federal government. Option C, the federal government. Option D, the Joint Commission. The correct answer is option A, state governments. State governments. Question 11. In the state of California, a nurse aide training course must include option A, 100 hours of theory and 60 hours of clinical. Option B, 60 hours of theory and 100 hours of clinical. Option C, 75 hours of theory and 100 hours of clinical. Option D, 60 hours of theory and 60 hours of clinical. The correct answer is option B, 60 hours of theory and 100 hours of clinical. 60 hours of theory and 100 hours of clinical. Question 12. OSHA regulations help protect the option A, healthcare facility. Option B, long-term care resident. Option C, resident's individual health information. Option D, healthcare worker. The correct answer is option D, healthcare worker. Healthcare worker. Question 13. Professionalism in healthcare includes option A, providing care with compassion. Option B, the strong work ethic. Option C, arriving to work before the start of your shift. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 14. One of your residents received a very upsetting diagnosis from his doctor this morning. His daughter comes in to visit and asks you why her father seems sad today. The best response is to option A, not answer in order to protect the resident's privacy. Option B, tell the daughter what happened since she is family. Option C, inform the daughter to call the resident's doctor about his diagnosis. Option D, suggest that the daughter discuss it with the resident. The correct answer is option D, suggest that the daughter discuss it with the resident. Suggest that the daughter discuss it with the resident. Question 15. You discover some chocolate candies in your resident's room. You know that she is on a diabetic diet and should not be eating the candies. You should, option A, take the candy out of the room. Option B, replace the candy with sugar-free chocolate. Option C, leave the candy in the room and report it to the nurse. Option D, tell the resident that she is not allowed to have chocolate. The correct answer is option C, leave the candy in the room and report it to the nurse. Leave the candy in the room and report it to the nurse. Question 16. Client is referred to as a resident when they are admitted to option A, a skilled nursing facility. Option B, an acute care facility. Option C, the community-based residential facility, CBRF. Option D, both A and C. The correct answer is option D, both A and C. Both A and C. Question 17. Residents with communication disabilities are at risk of abuse because they option A, don't recognize abuse when it happens. Option B, strike out at others. Option C, may be unable to report the abuse. Option D, have little control over their actions. The correct answer is option C, may be unable to report the abuse. May be unable to report the abuse. Question 18. One of your coworkers assists Mrs. Baker into a recliner and puts her feet up so she doesn't get out of the chair without assistance. Mrs. Baker is unable to use her call light because of dementia. This is an example of option A, abandonment. Option B, physical abuse. Option C, defamation. Option D, a false imprisonment. The correct answer is option D, false imprisonment. False imprisonment. Question 19. An example of battery might be option A, not repositioning a resident according to the care plan. Option B, telling a resident that if she refuses her meal, you will call her daughter. Option C, giving a resident a shower after she states she doesn't want one. Option D, leaving the facility before your relief arrives. The correct answer is option C, giving a resident a shower after she states she doesn't want one. Giving a resident a shower after she states she doesn't want one. Question 20. A resident offers to pay you for shampooing and curling her hair. You politely tell her that you enjoy caring for her and can't accept the money. She becomes upset, insisting that she doesn't feel right about having you style her hair without being compensated. The appropriate action to take is to option A, accept the money and put it in her room when she goes to activities. Option B, keep insisting that you are not allowed to accept gifts. Option C, accept the money and then give it to her family. Option D, accept the money and then give it to the nurse. The correct answer is option D, accept the money and then give it to the nurse. Accept the money and then give it to the nurse. Question 21. You knock and enter a resident's room to assist a coworker with the resident's bed bath. You find that the other nursing assistant has already begun the bed bath. The resident is crying during the procedure and is clearly upset. You should: Option A, report the abuse to the nurse immediately. Option B, assist your coworker to help complete the bed bath. Option C, tell the coworker that you need to report the incident. Option D, suggest the coworker leave the room while you finish the bed bath. The correct answer is option D. Suggest the coworker leave the room while you finish the bed bath. Suggest the coworker leave the room while you finish the bed bath. Question 22. Ruth is a resident who is incontinent and must have her incontinence garment changed every 2 hours. You have been busy this afternoon and have not been able to check and change her garment as indicated on the care plan. Ruth now has an open area on her bottom from being exposed to the urine. This is an example of: Option A, assault. Option B, negligence. Option C, abandonment. Option D, abuse. The correct answer is option B, negligence. Negligence. Question 23. Negligence occurs when a caregiver: Option A, does not follow the standards of her job. Option B, does not provide care and the resident then suffers harm. Option C, physically touches the resident without permission. Option D, limits the resident's ability to move throughout the facility. The correct answer is option A, does not follow the standards of her job. Does not follow the standards of her job. Question 24. You work as a nursing assistant at a local nursing home and are assigned to care for Kara. This evening, Kara tells you that she saw another staff member take money from her bedside table. You report this to the nurse. The nurse tells you that she isn't going to do anything regarding the money since Kara is forgetful and she likely misplaced it. The next step to take is to: Option A, suggest to Kara that she call the ombudsman. Option B, update the director of nurses. Option C, contact the volunteer ombudsman. Option D, do nothing, since that is the nurse's directive. The correct answer is option B, update the director of nurses. Update the director of nurses. Question 25. You can better understand the resident's feelings by: Option A, using easily understood yes/no questions. Option B, expressing your sympathy. Option C, being aware of nonverbal communication. Option D, of focusing on you statements. The correct answer is option C, being aware of nonverbal communication. Being aware of nonverbal communication. Question 26. You are caring for Alfonso, a 78-year-old man with receptive aphasia. His care plan states to use short, direct directives when providing care. While you are assisting him with bathing, he becomes tearful and upset. You should: Option A, have a coworker ask Alfonso what he needs. Option B, ask a family member to speak with him. Option C, use a picture board to help Alfonso communicate. Option D, speak in a lower tone of voice while giving care. The correct answer is option C, use a picture board to help Alfonso communicate. Use a picture board to help Alfonso communicate. Question 27. Stella is a 10-year-old girl with complete hearing loss due to an infection she had as an infant. This is an example of: Option A, an emotional deficit. Option B, an acquired communication disorder. Option C, expressive aphasia. Option D, a congenital communication disorder. The correct answer is option B, an acquired communication disorder. An acquired communication disorder. Question 28. Receptive aphasia is the inability to: Option A, understand spoken language. Option B, understand written messages. Option C, hear the spoken word. Option D, speak clearly to others. The correct answer is option A, understand spoken language. Understand spoken language. Question 29. A set of attitudes and traditions that are shared by a group of people is referred to as the groups. Option A, culture. Option B, national background. Option C, ethnicity. Option D, origins. The correct answer is option A, culture. Culture. Question 30. You are caring for a resident who wears a hearing aid in his left ear and is deaf in his right ear. When caring for him, you should: Option A, raise your voice when you speak into his right ear. Option B, turn the volume on the hearing aid all the way up. Option C, use a picture board for communication. Option D, ensure that his hearing aid is in and speak into his left ear. The correct answer is option D, ensure that his hearing aid is in and speak into his left ear. Ensure that his hearing aid is in and speak into his left ear. Question 31. Personal computers that translate a typed phrase into speech would best help a resident with Option A, receptive aphasia. Option B, autism. Option C, hearing loss. Option D, expressive aphasia. The correct answer is option D, expressive aphasia. Expressive aphasia. Question 32. You are caring for Bernice, a resident with severe hearing loss. Tonight, she seems to be having a more difficult time understanding you. The first action to take is to Option A, report this change to the nurse. Option B, find a picture book for Bernice. Option C, make sure Bernice has her hearing aids in. Option D, change the batteries in the hearing aid. The correct answer is option C, make sure Bernice has her hearing aids in. Make sure Bernice has her hearing aids in. Question 33. When caring for a resident with autism, it is important to Option A, maintain a consistent daily routine. Option B, engage the resident in conversation and activities. Option C, use nonverbal gestures to communicate with the resident. Option D, sit down next to the resident and maintain eye contact. The correct answer is option A, maintain a consistent daily routine. Maintain a consistent daily routine. Question 34. You knock and enter Faith's room to assist her to supper. You discover Faith and her daughter arguing about finances and the sale of Faith's house. The argument becomes louder and Faith begins to cry. The first action you should take is to Option A, assist Faith to a safe area. Option B, ensure that you are safe. Option C, alert the nurse. Option D, ask the daughter to leave the room. The correct answer is option B, ensure that you are safe. Ensure that you are safe. Question 35. A whiteboard and dry erase marker are tools that would help a resident with Option A, autism. Option B, post-traumatic stress. Option C, expressive aphasia. Option D, impaired vision. The correct answer is option C, expressive aphasia. Expressive aphasia. Question 36. An emotional communication deficit occurs when Option A, a caregiver doesn't adapt her care to the resident. Option B, the resident doesn't understand nonverbal messages. Option C, social interaction and communication are impaired. Option D, both B and C happen. The correct answer is option D, both B and C happen. Both B and C happen. Question 37. Having a growth mindset means you can Option A, demonstrate caring and compassion for others. Option B, comfort yourself in times of stress or illness. Option C, envision a happier version of yourself. Option D, be optimistic when speaking with others. The correct answer is option C, envision a happier version of yourself. Envision a happier version of yourself. Question 38. Mark is a 40-year-old resident who suffers from post-traumatic stress disorder. He experiences nightmares, doesn't engage in conversation with his caregivers, and rarely makes eye contact. This is an example of an Option A, neurological disorder. Option B, emotional deficit. Option C, expressive aphasia. Option D, speech impairment. The correct answer is option B, emotional deficit. Emotional deficit. Question 39. Your facility has lost electrical power due to a severe thunderstorm. The facility should Option A, wait to see when the power return. Option B, evacuate the residents to a different location. Option C, use the backup generator. Option D, have the nursing assistants use flashlights. The correct answer is option C, use the backup generator. Use the backup generator. Question 40. One of your residents has lung cancer and must use oxygen. There isn't enough space in the dining room for all the residents and his oxygen machine, too. The best option is to Option A, ask the resident to eat his meals in his room. Option B, offer 2 mealtimes to accommodate all the residents. Option C, have the resident eat in the dining room before the other residents. Option D, place the oxygen machine in the hallway. The correct answer is option B, offer 2 mealtimes to accommodate all the residents. Offer 2 mealtimes to accommodate all the residents. Question 41. One of your residents is unable to press her call light button because of pain in her hands. You should Option A, offer her pain medication. Option B, tell her to remain at the nurse's desk. Option C, locate a press pad light to place in her room. Option D, ask her to come to the nurse's desk if she needs assistance. The correct answer is option C, locate a press pad light to place in her room. Locate a press pad light to place in her room. Question 42. Dependent residents should be toilet or have their incontinence garments changed. Option A, every 2 hours and as needed. Option B, every 4 hours and as needed. Option C, only when the incontinence garment is soiled. Option D, only when requested by the resident. The correct answer is option A, every 2 hours and as needed. Every 2 hours and as needed. Question 43. You notice that one of the residents has spilled her water onto the dining room floor. You are still clearing dishes from the room and documenting the resident's oral intake. You should. Option A, leave a towel on the floor to soak up the water. Option B, ask housekeeping to take care of the spill. Option C, mop up the floor after you have finished clearing tables. Option D, mop up the spill and then finish clearing the tables. The correct answer is option D, mop up the spill and then finish clearing the tables. Mop up the spill and then finish clearing the tables. Question 44. A long-term care facility must have handrails located. Option A, on one side of the corridor. Option B, on both sides of the corridors. Option C, in the shower room. Option D, in the dining room. The correct answer is option B, on both sides of the corridors. On both sides of the corridors. Question 45. You discover one of your residents with dementia drinking from a bottle of floor cleaner. The first action to take is to: Option A, look up the chemical in the SDS. Option B, contact the poison control center. Option C, alert the nurse. Option D, try to get the resident to vomit. The correct answer is option C, alert the nurse. Alert the nurse. Question 46. While cleaning Angela's room, you come across one of her used insulin needles and accidentally poke yourself in the hand. Your first response is to: Option A, go to the emergency room for an evaluation. Option B, wash your hands with soap and water. Option C, fill out an incident report. Option D, report the incident to your supervisor. The correct answer is option B, wash your hands with soap and water. Wash your hands with soap and water. Question 47. You are assisting with a resident's shower when you slip on the wet floor. Luckily, you were able to catch yourself and don't think you have been hurt. You should. Option A, report the incident if you start feeling pain. Option B, do nothing since you weren't hurt. Option C, fill out an incident report. Option D, ask to go home and rest. The correct answer is option C, fill out an incident report. Fill out an incident report. Question 48. A healthcare facility is required to have all of the following except: Option A, a pest control program. Option B, outside ventilation. Option C, the sprinkler system. Option D, smoking areas. The correct answer is option D, smoking areas. Smoking areas. Question 49. You have noticed that one of your coworkers seems teary and upset the last few weeks. She has not told you what is wrong, but you are worried about her. The best action to take would be to: Option A, refer her to the employee assistance plan. Option B, contact the facility supervisor. Option C, do nothing, it is a private issue. Option D, tell the nurse that your coworker needs help. The correct answer is option A, refer her to the employee assistance plan. Refer her to the employee assistance plan. Question 50. An EAP is a service that provides free counseling services for: Option A, the unemployed. Option B, residents with complaints or concerns. Option C, employees with drug and alcohol abuse. Option D, employers during the hiring process. The correct answer is option C, employees with drug and alcohol abuse. Employees with drug and alcohol abuse. Question 51. A resident's closet in a long-term care facility must: Option A, have easy access handles. Option B, have shelves accessible to the resident. Option C, be shared with the resident's roommate. Option D, be at least 20 square feet in size. The correct answer is option B, have shelves accessible to the resident. Have shelves accessible to the resident. Question 52. Employers try to control exposure to bloodborne pathogens by: Option A, offering free hepatitis B vaccines to employees. Option B, providing only latex gloves for employees. Option C, offering free chickenpox vaccines. Option D, keeping chemicals in a locked room. The correct answer is option A, offering free hepatitis B vaccines to employees. Offering free hepatitis B vaccines to employees. Question 53. Allergic contact dermatitis after contact with latex usually is seen within. Option A, 15 to 30 minutes. Option B, 2 to 4 hours. Option C, 6 to 48 hours. Option D, 48 to 72 hours. The correct answer is option C, 6 to 48 hours. 6 to 48 hours. Question 54. You are ambulating Joe in the hallway with his walker and a gait belt. A coworker is following behind with Joe's wheelchair. Joe becomes shaky and weak. The best thing to do is to: Option A, walk him back to his room and lay him down. Option B, lower him to the floor using the gait belt. Option C, immediately sit him in his wheelchair. Option D, call out to the nurse or coworker for assistance. The correct answer is option C, immediately sit him in his wheelchair. Immediately sit him in his wheelchair. Question 55. Residents must be repositioned while in bed at least every: Option A, 1 hour. Option B, 2 hours. Option C, 3 hours. Option D, 4 hours. The correct answer is option B, 2 hours. 2 hours. Question 56. To relieve pressure while in the supine position, pillows should be placed under the head and: Option A, under the lower legs. Option B, between the legs. Option C, under the hips. Option D, behind the back. The correct answer is option A, under the lower legs. Under the lower legs. Question 57. To prevent pressure injuries from developing while a resident is sitting in a wheelchair, you should make sure that the resident has: Option A, her buttocks all the way back in the chair. Option B, her feet touching the floor. Option C, her feet elevated on the wheelchair footrests. Option D, both A and B. The correct answer is option D, both A and B. Both A and B. Question 58. A resident in the high Fowler's position has the head of the bed elevated. Option A, 80 to 90 degrees. Option B, 60 to 70 degrees. Option C, 20 to 30 degrees. Option D, 90 to 100 degrees. The correct answer is option A, 80 to 90 degrees. 80 to 90 degrees. Question 59. The best position for a resident who needs an enema is: Option A, prone. Option B, supine. Option C, Simses. Option D, semi-Fowlers. The correct answer is option C, Simses. Simses. Question 60. When repositioning the resident from a supine to a side-lying position: Option A, raise the side rail on the opposite side of the bed you are working on. Option B, raise the head of the bed before moving the resident. Option C, place a pillow behind the head and under the heels. Option D, leave the side rail up when finished for safety. The correct answer is option A, raise the side rail on the opposite side of the bed you are working on. Raise the side rail on the opposite side of the bed you are working on. Question 61. When repositioning a resident in bed, have him place his hands: Option A, above his head. Option B, along his sides. Option C, across his stomach or chest. Option D, on his hips or thighs. The correct answer is option C, across his stomach or chest. Across his stomach or chest. Question 62. You care for a resident who needs oxygen because of a respiratory infection. The best position for the resident while she is in bed is: Option A, Fowlers. Option B, side-lying. Option C, prone. Option D, tripod. The correct answer is option A, Fowlers. Fowlers. Question 63. A resident who is unable to bear weight needs to be transferred with a: Option A, mechanical lift and 2 nursing assistants. Option B, sit-to-stand device and 2 nursing assistants. Option C, a mechanical lift and 1 nursing assistant. Option D, gait belt and pivot disc. The correct answer is option A, mechanical lift and 2 nursing assistants. Mechanical lift and 2 nursing assistants. Question 64. You have assisted your resident from a lying to a sitting position on the bed. While letting him dangle at the side of the bed, you should: Option A, get a gait belt from the supply area. Option B, stand in front of the resident. Option C, pick out clothes from the closet. Option D, sit with the resident until he is ready to stand. The correct answer is option B, stand in front of the resident. Stand in front of the resident. Question 65. When transferring a resident with a 1-assist and gait belt, you should: Option A, grasp the gait belt with one hand just above the resident's stomach. Option B, stand in front of the resident and bend at the waist. Option C, grasp the gait belt with both hands and bend at the knees. Option D, hold the gait belt with one hand while lifting under the arms. The correct answer is option C, grasp the gait belt with both hands and bend at the knees. Grasp the gait belt with both hands and bend at the knees. Question 66. Risk factors for acquiring MRSA include: Option A, advanced age. Option B, working in a healthcare facility. Option C, having allergies. Option D, both A and B. The correct answer is option D, both A and B. Both A and B. Question 67. The recommended precaution used when caring for a resident with VRE is: Option A, airborne. Option B, standard. Option C, contact. Option D, droplet. The correct answer is option C, contact. Contact. Question 68. During hand washing, the nursing assistant should lather her hands for at least: Option A, 20 seconds. Option B, 10 seconds. Option C, 60 seconds. Option D, 15 seconds. The correct answer is option A, 20 seconds. 20 seconds. Question 69. To be effective, the level of alcohol in hand sanitizers must be at least: Option A, 60%. Option B, 20%. Option C, 35%. Option D, of 45%. The correct answer is option A, 60%. 60%. Question 70. Standard precautions should be practiced on: Option A, only people who request it. Option B, only people who look sick. Option C, only people who have a bloodborne illness. Option D, every person you care for. The correct answer is option D, every person you care for. Every person you care for. Question 71. Older adults are at a higher risk of infection because: Option A, they don't wash their hands as often. Option B, people's immune systems grow weaker as they age. Option C, blood circulation increases as a person ages. Option D, they watch more television. The correct answer is option B, people's immune systems grow weaker as they age. People's immune systems grow weaker as they age. Question 72. The main reason a nursing assistant should not wear artificial nails to work is that: Option A, residents may not like them. Option B, they hurt the resident. Option C, they may be damaged by frequent hand washing. Option D, they harbor bacteria. The correct answer is option D, they harbor bacteria. They harbor bacteria. Question 73. The nurse informs you that one of your residents has influenza. Before assisting the resident with her shower, you should put on an Option A, isolation gown and gloves immediately after entering the room. Option B, surgical mask before entering the room. Option C, N95 mask after entering the room. Option D, particulate respirator before entering the room. The correct answer is option B, surgical mask before entering the room. Surgical mask before entering the room. Question 74. Donning personal protective equipment should be done in the following order: Option A, gown, gloves, goggles, mask. Option B, gown, mask, goggles, gloves. Option C, mask, goggles, gown, gloves. Option D, gloves, gown, mask, goggles. The correct answer is option B, gown, mask, goggles, gloves. Gown, mask, goggles, gloves. Question 75. The nursing assistant must wash her hands rather than use hand sanitizer. Option A, after taking off gloves. Option B, before leaving the facility. Option C, after using the restroom. Option D, when caring for a resident with MRSA. The correct answer is option C, after using the restroom. After using the restroom. Question 76. Most staph infections occur: Option A, on the skin. Option B, in the eyes. Option C, in the nose and respiratory tract. Option D, in the digestive tract. The correct answer is option A, on the skin. On the skin. Question 77. Non-specific defense mechanisms that keep a person healthy include all of the following except option A, antibodies, option B, intact skin, option C, mucus in the nose, option D, cilia in the lungs. The correct answer is option A, antibodies. Antibodies. Question 78. The specialty precaution required to care for a resident with Clostridium difficile is option A, droplet precautions with hand washing or hand sanitizer, option B, airborne precautions with hand washing only, option C, contact precautions with either hand washing or hand sanitizer, option D, contact precautions with hand washing only. The correct answer is option D, contact precautions with hand washing only. Contact precautions with hand washing only. Question 79. Charles is on a fluid restriction and must have all his fluid intake measured. This evening he had a 4-ounce glass of apple juice, an 8-ounce carton of milk, and a 4-ounce cup of ice cream. The total amount you should document is option A, 360 milliliters, option B, 480 milliliters, option C, 12 ounces, option D, 16 ounces. The correct answer is option B, 480 milliliters. 480 milliliters. Question 80. When measuring urine output, the graduate or urinal should be option A, placed on the overbed table, option B, placed on the bathroom counter, option C, raised to eye level, option D, emptied onto a bed pan. The correct answer is option B, placed on the bathroom counter. Placed on the bathroom counter. Question 81. Angela is a new resident being admitted today. The nurse asked you to obtain her weight. You notice her from her medical chart that her most recent weight was 407 pounds. The best option for getting Angela's weight is to A. Option A, standing scale. Option B, a mechanical lift. Option C, bariatric lift. Option D, wheelchair scale. The correct answer is option C, bariatric lift. Bariatric lift. Question 82. One of your residents' weight this morning is 83 pounds. The nurse asks you how many kilograms the resident weighs. The correct reply is option A, 37.7 kilograms, option B, 182.6 kilograms, option C, 166 kilograms, option D, of 41.5 kilograms. The correct answer is option A, 37.7 kilograms. 37.7 kilograms. Question 83. The best device for weighing a resident who is on strict bed rest is A. Option A, wheelchair scale. Option B, a mechanical lift scale. Option C, stadiometer. Option D, bariatric lift scale. The correct answer is option B, mechanical lift scale. Mechanical lift scale. Question 84. In healthcare, measurements most often documented in the metric system include option A, fluid intake. Option B, food intake. Option C, blood pressure. Option D, both A and C. The correct answer is option D, both A and C. Both A and C. Question 85. The first step in measuring a resident's weight with a wheelchair scale is to option A, push the wheelchair onto the scale. Option B, make sure the scale reads 0.0 pounds. Option C, remove any assistive devices from the wheelchair. Option D, press the 0 button. The correct answer is option C, remove any assistive devices from the wheelchair. Remove any assistive devices from the wheelchair. Question 86. You weighed Charles this morning and notice that he has gained 5 pounds since last week. The appropriate action to take is to option A, instruct Charles to follow his ordered diet. Option B, ask Charles if this is his correct weight. Option C, report the weight gain to the nurse right away. Option D, re-weigh Charles to make sure you have an accurate weight. The correct answer is option C, report the weight gain to the nurse right away. Report the weight gain to the nurse right away. Question 87. The goal of debridement is to option A, remove healthy tissue. Option B, remove necrotic tissue. Option C, strengthen the tissue. Option D, decrease edema. The correct answer is option B, remove necrotic tissue. Remove necrotic tissue. Question 88. The best way to prevent rashes in a resident who has skin folds is to Option A, keep the area clean and dry. Option B, use rinseless products only. Option C, apply lotion to the area daily. Option D, only wash once per day. The correct answer is option A, keep the area clean and dry. Keep the area clean and dry. Question 89. The major risk factor for development of pressure injuries is option A, immobility. Option B, poor nutrition. Option C, incontinence. Option D, advanced age. The correct answer is option A, immobility. Immobility. Question 90. Friction and shearing injuries often occur while the resident is option A, sitting in the wheelchair. Option B, lying on his side. Option C, in bed with the head of the bed elevated. Option D, in a supine position. The correct answer is option C, in bed with the head of the bed elevated. In bed with the head of the bed elevated. Question 91. Stage 2 and Stage 3 pressure injuries can be very. Option A, painful. Option B, blistered. Option C, swollen. Option D, hidden. The correct answer is option A, painful. Painful. Question 92. One of the main functions of our skin is to option A, carry nutrients. Option B, clump melanocytes. Option C, protect against infection. Option D, transport oxygen. The correct answer is option C, protect against infection. Protect against infection. Question 93. Stage 2 pressure injuries involve damage to option A, the dermis. Option B, the epidermis. Option C, the subcutaneous tissue. Option D, both A and B. The correct answer is option D, both A and B. Both A and B. Question 94. The best method for ensuring proper water temperature when assisting a resident with a shower is option A, asking the resident if the water is a comfortable temperature. Option B, using a bath thermometer to check the water temperature before allowing the resident into the shower. Option C, allowing the water to run at least 10 minutes before the resident enters the shower. Option D, testing the water with your hand. The correct answer is option A, asking the resident if the water is a comfortable temperature. Asking the resident if the water is a comfortable temperature. Question 95. While shampooing the resident's hair in the shower, you should ask her to option A, tip her head forward. Option B, tip her head to the side. Option C, hold a washcloth over her eyes. Option D, close her eyes and breathe through her nose. The correct answer is option C, hold a washcloth over her eyes. Hold a washcloth over her eyes. Question 96. David is an older resident with dementia. You need to bathe him this morning, but he refuses. You should option A, ask him why he doesn't want to bathe, and then attempt later. Option B, tell him that he needs to get into the tub, as that is the schedule. Option C, take him to the tub room and start undressing him. Option D, ask the nurse to bathe him. The correct answer is option A, ask him why he doesn't want to bathe, and then attempt later. Ask him why he doesn't want to bathe, and then attempt later. Question 97. The nursing assistant can help prevent skin breakdown by option A, encouraging fluid intake. Option B, repositioning every 2 hours in bed. Option C, offering protein-rich foods. Option D, doing all of the above. The correct answer is option D, doing all of the above. Doing all of the above. Question 98. Mouthwash should be offered to the alert and oriented resident. Option A, before providing oral care. Option B, after providing oral care. Option C, as a replacement for brushing. Option D, either A or B. The correct answer is option D, either A or B. Either A or B. Question 99. Michael is a hospital patient recovering from a car accident. He has an 4 in his right hand. You need to dress Michael in a clean hospital gown. You should option A, feed the 4 bag and tubing through the right sleeve, followed by his right arm. Option B, feed the 4 bag and tubing through the left sleeve, followed by his left arm. Option C, put his right arm through the right sleeve, followed by the 4 bag and tubing. Option D, have the nurse disconnect the 4 tubing while you dress Michael. The correct answer is option A, feed the 4 bag and tubing through the right sleeve, followed by his right arm. Feed the 4 bag and tubing through the right sleeve, followed by his right arm. Question 100. A resident's routine shower schedule is typically Option A, weekly. Option B, 1 to 2 times a week and PRN. Option C, once per day. Option D, upon request only. The correct answer is option B, 1 to 2 times a week and PRN. 1 to 2 times a week and PRN. Question 101. A stage 1 pressure injury appears as: Option A, a partial thickness skin loss. Option B, intact reddened skin. Option C, the full thickness skin loss. Option D, the shallow crater. The correct answer is option B, intact reddened skin. Intact reddened skin. Question 102. A partial bed bath consists of washing a resident's: Option A, face, hands, arms, and underarms. Option B, hands, underarms, underbreasts, and back. Option C, face, hands, arms, and periarea. Option D, face, hands, underarms, skin folds, and periarea. The correct answer is option D, face, hands, underarms, skin folds, and periarea. Face, hands, underarms, skin folds, and periarea. Question 103. You are assigned to take care of Elizabeth, an older resident with dementia. She refuses to allow you to brush her teeth this morning. You should: Option A, offer her a small amount of mouthwash instead of brushing. Option B, inform the nurse that you are unable to provide oral care. Option C, not provide oral care, since she has the right to refuse. Option D, use a pre-moistened oral swab to provide oral care. The correct answer is option D, use a pre-moistened oral swab to provide oral care. Use a pre-moistened oral swab to provide oral care. Question 104. A hospital resident is typically given a shower. Option A, on an as-needed basis. Option B, never. Option C, once per day. Option D, upon request only. The correct answer is option A, on an as-needed basis. On an as-needed basis. Question 105. If a male resident is not circumcised, you should: Option A, not wash this area, it is out of your scope of practice. Option B, pull the foreskin back and wash. Option C, ask the resident to pull back the foreskin while you wash. Option D, not wash this area, it is not required. The correct answer is option B, pull the foreskin back and wash. Pull the foreskin back and wash. Question 106. Providing fingernail and hand care for a resident helps to: Option A, prevent nails from cracking. Option B, maintain self-esteem. Option C, prevent the resident from scratching herself. Option D, do all of the above. The correct answer is option D, do all of the above. Do all of the above. Question 107. You are caring for a male resident who needs to be shaved. He has an electric razor with multiple heads. You should shave him by moving the razor. Option A, in a circular pattern over the face only. Option B, downward over the face and upward on the neck. Option C, downward over the cheeks and upper lip, upward on the chin and neck. Option D, in a circular pattern over the face and neck. The correct answer is option D, in a circular pattern over the face and neck. In a circular pattern over the face and neck. Question 108. When providing oral care for a resident with natural teeth, you should: Option A, hold the toothbrush at a 90-degree angle to the gums. Option B, hold the toothbrush at a 45-degree angle to the gums. Option C, brush the chewing surfaces of the teeth first. Option D, brush the resident's tongue first. The correct answer is option B, hold the toothbrush at a 45-degree angle to the gums. Hold the toothbrush at a 45-degree angle to the gums. Question 109. You see a red, rashy area with white exudate under a resident's breast. You should: Option A, cleanse the area with soap and water, and then change gloves and hand sanitize after washing the area. Option B, report your findings to the nurse. Option C, use a new set of washcloths and towels for the rest of the bath. Option D, do all of the above. The correct answer is option D, do all of the above. Do all of the above. Question 110. Bathing offers the nursing assistant a unique opportunity to check the residents. Option A, hair. Option B, fingernails. Option C, skin. Option D, toenails. The correct answer is option C, skin. Skin. Question 111. The nursing assistant should trim a resident's fingernails. Option A, straight across to avoid hangnails. Option B, only on the resident's bath day. Option C, along the finger's natural curve. Option D, after applying lotion to the resident's hand. The correct answer is option C, along the finger's natural curve. Along the finger's natural curve. Question 112. When assisting a resident with foot care, allow the feet to soak. Option A, 2 to 5 minutes. Option B, 8 to 10 minutes. Option C, 15 to 20 minutes. Option D, 20 to 30 minutes. The correct answer is option A, 2 to 5 minutes. 2 to 5 minutes. Question 113. The nursing assistant can clean hearing aids by using option A, a toothpick. Option B, an alcohol wipe. Option C, a cotton-tipped swab. Option D, none of the above. The correct answer is option B, an alcohol wipe. An alcohol wipe. Question 114. A resident who is taking blood thinners should be shaved. Option A, by the doctor only. Option B, using a disposable straight razor. Option C, using an electric razor. Option D, only if the family requests it. The correct answer is option C, using an electric razor. Using an electric razor. Question 115. The nursing assistant should check the skin beneath a prosthesis at least. Option A, once a week. Option B, twice a week. Option C, once a day. Option D, once a month. The correct answer is option C, once a day. Once a day. Question 116. After taking off your resident's prosthesis, you see a small blistered area. You should. Option A, cleanse the area with hydrogen peroxide to dry the blister. Option B, apply barrier cream to the skin to prevent further friction. Option C, place clean gauze under the prosthetic for comfort. Option D, do not apply the prosthetic and report to the nurse. The correct answer is option D, do not apply the prosthetic and report to the nurse. Do not apply the prosthetic and report to the nurse. Question 117. The areas at greatest risk of skin breakdown when a resident is in a supine position are option A, the coccyx, elbows, and heels. Option B, the buttocks, knees, and toes. Option C, the ear, hip, and ankles. Option D, all of the above. The correct answer is option A, the coccyx, elbows, and heels. The coccyx, elbows, and heels. Question 118. A resident's colostomy bag should be emptied. Option A, when the bag is close to full. Option B, when the bag is about half full. Option C, if there is any amount of stool present. Option D, at least once each day. The correct answer is option B, when the bag is about half full. When the bag is about half full. Question 119. Anti-embolism stockings are most often put on. Option A, each morning when the resident is sitting in his wheelchair. Option B, each morning before getting out of bed. Option C, in the evening before the resident is assisted into bed. Option D, only if the resident has swelling in the legs. The correct answer is option B, each morning before getting out of bed. Each morning before getting out of bed. Question 120. When a resident is bathing in the bathroom, the door should always remain locked for privacy. Option A, true. Option B, false. The correct answer is option B, false. False. Question 121. When brushing a patient's teeth, brush the front surfaces only. Option A, true. Option B, false. The correct answer is option B, false. False. Question 122. Before putting a resident's glasses on her, you should check. Option A, all of the above. Option B, skin integrity behind the ears. Option C, that the glasses are clean. Option D, that all parts of the glasses are intact and functioning. The correct answer is option A, all of the above. All of the above. Question 123. While shampooing the resident's hair in the tub, the nursing assistant should ask the resident to option A, tip her head back. Option B, tip her head forward. Option C, close her eyes and breathe through her nose. Option D, explain that staff must follow the bath schedule. The correct answer is option A, tip her head back. Tip her head back. Question 124. Alva is a resident recovering from a stroke. She has right-sided weakness and needs your assistance with dressing. You should remove her pajama top. Option A, from her left arm first, and then from her right arm. Option B, from her right arm first while supporting the elbow. Option C, by removing both pajama sleeves at the same time. Option D, from her left arm first, and then over the head. The correct answer is option A, from her left arm first, and then from her right arm. From her left arm first, and then from her right arm. Question 125. The best medicinal bath for a resident with painful hemorrhoids is A.N. Option A, oatmeal bath. Option B, Epsom salt bath. Option C, Bran bath. Option D, sitz bath. The correct answer is option D, sitz bath. Sitz bath. Question 126. To reposition a resident in bed, the best tool the nursing assistant can use is the option A, draw sheet. Option B, incontinence pad. Option C, fitted sheet. Option D, a mattress pad. The correct answer is option A, draw sheet. Draw sheet. Question 127. Linens in long-term care facilities are typically changed. Option A, every day. Option B, once or twice a week. Option C, every 2 weeks. Option D, only as needed. The correct answer is option B, once or twice a week. Once or twice a week. Question 128. After completing an occupied bed change, soiled linens should be: option A, placed in a bag on the floor. Option B, carried to the laundry room with gloved hands. Option C, placed in the resident's bathroom and collected daily. Option D, placed in a bag and carried to the laundry room with ungloved hands. The correct answer is option D, placed in a bag and carried to the laundry room with ungloved hands. Placed in a bag and carried to the laundry room with ungloved hands. Question 129. A resident with a chronic condition is likely to have her oxygen at: option A, 6 to 8 liters per minute. Option B, 1 to 6 liters per minute. Option C, 8 to 10 liters per minute. Option D, 10 to 14 liters per minute. The correct answer is option B, 1 to 6 liters per minute. 1 to 6 liters per minute. Question 130. A nursing home resident unable to pay for services can be discharged. Option A, after a 90-day notice is given. Option B, only if he is admitted to another nursing home. Option C, only if he can return home safely. Option D, after a 30-day notice is given. The correct answer is option D, after a 30-day notice is given. After a 30-day notice is given. Question 131. You enter a resident's room with clean linens to make an occupied bed change. The best place to set the linens down is the: option A, resident's bed. Option B, roommate's bed. Option C, over bed table. Option D, resident's wheelchair. The correct answer is option C, over bed table. Over bed table. Question 132. To care for the resident in acute care, you must: option A, have at least 120 hours of work experience. Option B, have taken an acute care nursing assistant course. Option C, have experience in an ambulatory surgery setting. Option D, be able to identify critical situations promptly. The correct answer is option D, be able to identify critical situations promptly. Be able to identify critical situations promptly. Question 133. A catheter that is inserted into the bladder through an opening in the abdomen is called A.N. Option A, intermittent catheter. Option B, straight catheter. Option C, suprapubic catheter. Option D, urostomy. The correct answer is option C, suprapubic catheter. Suprapubic catheter. Question 134. A copy of a resident's discharge notice is sent to the resident or to: option A, the resident's doctor. Option B, one of the resident's family members. Option C, the resident's power of attorney. Option D, the ombudsman. The correct answer is option C, the resident's power of attorney. The resident's power of attorney. Question 135. Sharon is a resident who has an indwelling catheter in place. To decrease the risk of pulling or tugging on the catheter, you should: option A, secure the catheter with a catheter holder attached to her thigh. Option B, hang the urinary collection bag at the foot of the bed. Option C, lay the collection bag on the bed while Sharon sleeps. Option D, change the collection bag to a leg bag while Sharon is in bed. The correct answer is option A, secure the catheter with a catheter holder attached to her thigh. Secure the catheter with a catheter holder attached to her thigh. Question 136. When making a bed, you should place the top edge of the bedspread. Option A, 12 inches below the top of the mattress. Option B, 6 inches above the top of the mattress. Option C, even with the top of the mattress. Option D, 6 inches below the top of the mattress. The correct answer is option C, even with the top of the mattress. Even with the top of the mattress. Question 137. The nurse asks you to obtain a stool specimen from one of your residents. The stool sample may be taken from Option A, a commode hat. Option B, the traditional bedpan. Option C, the clean and used commode. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 138. A clear liquid diet is started after a post-surgical resident can. Option A, ambulate. Option B, urinate. Option C, pass gas. Option D, defecate. The correct answer is option C, pass gas. Pass gas. Question 139. Side rails that are raised during an occupied bed change. Option A, are considered a positioning aid. Option B, should be lowered when you are done. Option C, should be left raised to prevent falls. Option D, both A and B. The correct answer is option D, both A and B. Both A and B. Question 140. An example of an acute condition is Option A, an asthma attack. Option B, emphysema. Option C, osteoarthritis. Option D, diabetes. The correct answer is option A, an asthma attack. An asthma attack. Question 141. A resident's oxygen concentrator should be kept away from the wall at least. Option A, 2 inches. Option B, 6 inches. Option C, 12 inches. Option D, 18 inches. The correct answer is option C, 12 inches. 12 inches. Question 142. The draw sheet should be placed on the bed. Option A, folded in half with the fold toward the foot of the bed. Option B, folded in half with the fold toward the head of the bed. Option C, unfolded with the wide hem at the head of the bed. Option D, with the absorbent white side facing up. The correct answer is option B, folded in half with the fold toward the head of the bed. Folded in half with the fold toward the head of the bed. Question 143. Residents who have had orthopedic surgery are likely to be assigned A. Option A, lengthy NPO status. Option B, weight-bearing status. Option C, speech therapist. Option D, a one-on-one nursing assistant. The correct answer is option B, weight-bearing status. Weight-bearing status. Question 144. A resident in a wheelchair should have her urinary collection bag. Option A, hung on the back of the wheelchair. Option B, hung from the bars under the wheelchair seat. Option C, disconnected from the catheter. Option D, fastened to the resident's leg. The correct answer is option B, hung from the bars under the wheelchair seat. Hung from the bars under the wheelchair seat. Question 145. Ambulatory surgery is designed for Option A, orthopedic surgeries. Option B, cardiac surgeries. Option C, minor surgeries. Option D, complex surgeries. The correct answer is option C, minor surgeries. Minor surgeries. Question 146. Leanna is a resident who is on oxygen at 4 liters per minute. When you enter her room, you notice that the humidification bottle is not bubbling. This means that Option A, the oxygen is not flowing properly. Option B, Leanna has taken the nasal cannula out of her nose. Option C, the oxygen is flowing at the correct rate. Option D, the oxygen rate needs to be turned down. The correct answer is option A, the oxygen is not flowing properly. The oxygen is not flowing properly. Question 147. A stool sample should be taken from Option A, any part of the stool, it does not matter. Option B, the middle of the stool. Option C, the ends of the stool. Option D, both B and C. The correct answer is option D, both B and C. Both B and C. Question 148. Splinting is the intervention used to decrease pain during Option A, toileting immediately following surgery. Option B, walking the length of the hallway. Option C, coughing and deep breathing exercises. Option D, repositioning in bed. The correct answer is option C, coughing and deep breathing exercises. Coughing and deep breathing exercises. Question 149. A resident who has not had a bowel movement for 4 days is typically given. Option A, milk of magnesia. Option B, a suppository. Option C, the fleet enema. Option D, a soap suds enema. The correct answer is option B, a suppository. A suppository. Question 150. Linens should be fan-folded to one side of the bed when the resident is. Option A, being transferred from a stretcher to the bed. Option B, ready to go to bed for the night. Option C, first admitted to the hospital. Option D, at risk of developing pressure injuries. The correct answer is option A, being transferred from a stretcher to the bed. Being transferred from a stretcher to the bed. Question 151. Sarah has a skin tear on her left elbow. The wound has a small amount of drainage, and the dressing must be changed this morning. The best dressing type to use would be A. Option A, foam dressing. Option B, hydrogel dressing. Option C, transparent dressing. Option D, calcium alginate dressing. The correct answer is option C, transparent dressing. Transparent dressing. Question 152. A nasal cannula should be inserted into the nares. Option A, with the prongs curved away from the resident. Option B, with the prongs curved toward the resident. Option C, before turning the oxygen on and checking the flow rate. Option D, after bringing the sliding connector up toward the chin. The correct answer is option B, with the prongs curved toward the resident. With the prongs curved toward the resident. Question 153. Assembling all the necessary supplies before you begin to collect a sample will. Option A, ensure fast collection of the sample. Option B, save time during the documentation process. Option C, ensure that the sample is not contaminated. Option D, ensure the resident's right to privacy. The correct answer is option C, ensure that the sample is not contaminated. Ensure that the sample is not contaminated. Question 154. Another name for outpatient surgery is Option A, ambulatory surgery. Option B, convalescent surgery. Option C, mobile surgery. Option D, a walk-in surgery. The correct answer is option A, ambulatory surgery. Ambulatory surgery. Question 155. Joseph is a resident who just had knee replacement surgery a few hours ago and is on strict bed rest. The best method to prevent Joseph from developing blood clots is Option A, sequential stockings. Option B, anti-embolism stockings. Option C, active range of motion exercises. Option D, ambulating short distances. The correct answer is option A, sequential stockings. Sequential stockings. Question 156. You need to make an occupied bed, but your facility does not have bath blankets. You should Option A, dress the resident first and then make her bed. Option B, make the bed without covering the resident. Option C, have the resident sit in a chair while you make the bed. Option D, use the bedspread to cover the resident. The correct answer is option D, use the bedspread to cover the resident. Use the bedspread to cover the resident. Question 157. The most common reason to collect a urine specimen is to test for Option A, infection. Option B, cancer. Option C, diabetes. Option D, kidney disease. The correct answer is option A, infection. Infection. Question 158. Cleo is a resident with COPD. Her care plan states that she has oxygen ordered at 2 liters per minute. You find Cleo in her room with her oxygen concentrator set at 3 liters per minute. She tells you that she turned it up this morning because she was short of breath from walking in her room. You should Option A, turn the oxygen back down to 2 liters per minute immediately. Option B, let Cleo rest for a while and then change the oxygen to 2 liters per minute. Option C, report Cleo's shortness of breath and oxygen rate to the nurse right away. Option D, leave the oxygen at 3 liters per minute, since Cleo is alert and oriented. The correct answer is option C, report Cleo's shortness of breath and oxygen rate to the nurse right away. Report Cleo's shortness of breath and oxygen rate to the nurse right away. Question 159. Information indicated on the urine and stool sample container includes the residence. Option A, name, date of birth, identification number, and time collected. Option B, name, date of birth, and the date and time of the specimen collected. Option C, room number, maiden name, and social security number. Option D, name, room number, identification number, and admission date. The correct answer is option B, name, date of birth, and the date and time of the specimen collected. Name, date of birth, and the date and time of the specimen collected. Question 160. A device that delivers only a puff of oxygen with each breath is called a. Option A, conserving regulator. Option B, conventional regulator. Option C, face mask. Option D, a wall-mounted system. The correct answer is option A, conserving regulator. Conserving regulator. Question 161. You should collect linens in the following order. Option A, fitted sheet, top sheet, draw sheet, pillowcase, bath blanket. Option B, bedspread, blanket, top sheet, fitted sheet, bath blanket, pillowcase. Option C, bath blanket, fitted sheet, draw sheet, top sheet, blanket, bedspread, pillowcase. Option D, bath blanket, pillowcase, bedspread, to sheet, fitted sheet, draw sheet. The correct answer is option C, bath blanket, fitted sheet, draw sheet, top sheet, blanket, bedspread, pillowcase. Bath blanket, fitted sheet, draw sheet, top sheet, blanket, bedspread, pillowcase. Question 162. To ensure that the oxygen concentrator is working properly, the filter should be: Option A, replaced weekly by the oxygen supplier. Option B, removed daily and washed with soap and water. Option C, checked daily by the nurse and respiratory therapist. Option D, rinsed with tap water and dried when it become dirty. The correct answer is option D, rinsed with tap water and dried when it become dirty. Rinsed with tap water and dried when it become dirty. Question 163. Before you leave the residence room, a urine or stool sample should be played in. Option A, a plastic bag. Option B, the clean vinyl glove. Option C, a biohazard bag. Option D, none of the above. The correct answer is option C, a biohazard bag. A biohazard bag. Question 164. The nurse asks you to get Emily's vital signs. You find Emily in the activity room playing bingo. You should: Option A, after getting Emily's permission, take her to a private room and obtain the vital signs. Option B, get her vital signs later so you do not disturb the game. Option C, take the vital signs in the activity room while Emily continues to play. Option D, tell the nurse that you will get the vital signs after bingo is done. The correct answer is option A, after getting Emily's permission, take her to a private room and obtain the vital signs. After getting Emily's permission, take her to a private room and obtain the vital signs. Question 165. An axillary temperature is taken by placing the thermometer. Option A, under the resident's arm. Option B, into the resident's ear canal. Option C, on the resident's forehead. Option D, under the resident's tongue. The correct answer is option A, under the resident's arm. Under the resident's arm. Question 166. The normal range for an adult's heart rate is: Option A, 60 to 100 beats per minute. Option B, 70 to 120 beats per minute. Option C, 60 to 75 beats per minute. Option D, 50 to 80 beats per minute. The correct answer is option A, 60 to 100 beats per minute. 60 to 100 beats per minute. Question 167. Which blood pressure is not within normal limits for an adult? Option A, 130/86. Option B, 108/72. Option C, 118/76. Option D, 100/80. The correct answer is option A, 130/86. 130/86. Question 168. You need to obtain Esther's temperature this morning. You find her eating breakfast in her room. Before taking her temperature, you should wait. Option A, 15 to 20 minutes. Option B, about 60 seconds. Option C, 3 to 5 minutes. Option D, half hour. The correct answer is option A, 15 to 20 minutes. 15 to 20 minutes. Question 169. A respiratory rate that is greater than 20 breaths per minute is called: Option A, tachypnea. Option B, hypotension. Option C, bradycardia. Option D, tachycardia. The correct answer is option A, tachypnea. Tachypnea. Question 170. You have taken a resident's blood pressure with an electric arm cuff. The results are not within the normal range. The first thing you should do is: Option A, wait a minute and then retake the blood pressure manually. Option B, document the blood pressure in the resident's chart. Option C, immediately retake the blood pressure. Option D, report the blood pressure reading to the nurse. The correct answer is option A, wait a minute and then retake the blood pressure manually. Wait a minute and then retake the blood pressure manually. Question 171. You have taken a resident's vital signs this morning. Her temperature orally is 98.2 F, pulse is 56 beats per minute, respirations are 18 per minute, and blood pressure is 112/68. The measurement outside the normal range for an adult is the: Option A, pulse. Option B, respirations. Option C, blood pressure. Option D, temperature. The correct answer is option A, pulse. Pulse. Question 172. A resident living in a nursing home typically has his weight taken. Option A, once a week. Option B, once a month. Option C, each day. Option D, twice a month. The correct answer is option A, once a week. Once a week. Question 173. A resident who has an unwitnessed fall will usually have vital signs taken. Option A, immediately. Option B, every hour. Option C, every shift. Option D, every 15 minutes. The correct answer is option A, immediately. Immediately. Question 174. The blood pressure cuff should be applied above the antecubital space. Option A, true. Option B, false. The correct answer is option A, true. True. Question 175. The relaxation phase of the heart cycle is diastole. Option A, true. Option B, false. The correct answer is option A, true. True. Question 176. Your resident needs to increase her intake of vitamin B6. The foods that would best help her accomplish this would be: Option A, potatoes and cereals. Option B, almonds and spinach. Option C, cottage cheese and milk. Option D, fish and chicken. The correct answer is option A, potatoes and cereals. Potatoes and cereals. Question 177. A resident might need a pureed diet if he: Option A, has use of only his right hand. Option B, chokes easily on his coffee and juice. Option C, can no longer wear his dentures. Option D, has a difficult time chewing and swallowing meat. The correct answer is option C, can no longer wear his dentures. Can no longer wear his dentures. Question 178. Your resident is on a gluten-free diet. The item that you would question on her meal tray before giving it to her is: Option A, yogurt. Option B, almonds. Option C, beans. Option D, bagel. The correct answer is option D, bagel. Bagel. Question 179. You have no soapy washcloth to wash your dependent resident's hands with before he eats. You should: Option A, make sure that he does not touch his tray. Option B, wipe his hands with a paper towel. Option C, offer an adult wipe to the resident. Option D, do not wash his hands since he cannot feed himself. The correct answer is option C, offer an adult wipe to the resident. Offer an adult wipe to the resident. Question 180. Insoluble fiber aids in digestion by: Option A, binding to fat and pushing the fat through the digestive tract. Option B, promoting regular bowel movements. Option C, lowering cholesterol. Option D, regulating blood sugar levels. The correct answer is option B, promoting regular bowel movements. Promoting regular bowel movements. Question 181. Your resident drank a 4 ounces glass of juice and a 6 ounces glass of milk. This should be documented as: Option A, 4 ml. Option B, 10 ml. Option C, 240 ml. Option D, 300 ml. The correct answer is option D, 300 ml. 300 ml. Question 182. Your resident has undergone knee repair surgery and has just returned to the medical surgical floor. He is complaining of nausea and asks you for some ginger ale and crackers. Before you can give these to him, he would have to: Option A, have bowel sounds. Option B, sit upright for 30 minutes. Option C, tolerate chicken broth. Option D, ambulate 30 feet. The correct answer is option A, have bowel sounds. Have bowel sounds. Question 183. You are caring for a resident who is on a fluid restriction. When documenting his total fluid intake, you should include: Option A, milk. Option B, ice cream. Option C, gelatin. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 184. After feeding your resident, you should keep the head of the bed: Option A, in the lowest position. Option B, upright. Option C, flat. Option D, only as the resident requests. The correct answer is option B, upright. Upright. Question 185. The nutrient used for muscle and nerve function is: Option A, zinc. Option B, magnesium. Option C, iron. Option D, folic acid. The correct answer is option B, magnesium. Magnesium. Question 186. Fluid restrictions are most likely to be in place for the resident with: Option A, kidney failure. Option B, hypertension. Option C, diabetes. Option D, kidney stones. The correct answer is option A, kidney failure. Kidney failure. Question 187. You might think a resident is dehydrated if she: Option A, is asking to use the toilet every 2 hours. Option B, acts confused when normally she is alert and oriented. Option C, had 2 bowel movements today. Option D, complain of not sleeping well at night. The correct answer is option B, acts confused when normally she is alert and oriented. Acts confused when normally she is alert and oriented. Question 188. Grace is at risk of aspiration because she often drinks her fluids in large gulps. The device that Grace would most benefit from would be A. Option A, nosy cup. Option B, spout cup. Option C, cup with flow regulator. Option D, covered cup with straw. The correct answer is option C, cup with flow regulator. Cup with flow regulator. Question 189. Strategies to prevent falls can include: Option A, all of the above. Option B, encourage visits from family members. Option C, make sure alarms are in place. Option D, keep call light within reach. The correct answer is option A, all of the above. All of the above. Question 190. An alarm placed in a wheelchair is: Option A, not a fall prevention strategy. Option B, the fall prevention strategy. Option C, necessary for resident safety. Option D, required for residents in healthcare facilities. The correct answer is option A, not a fall prevention strategy. Not a fall prevention strategy. Question 191. If a resident falls, update the nurse. Option A, immediately. Option B, only if the resident is hurt. Option C, at the end of your shift. Option D, after you put the resident back to bed. The correct answer is option A, immediately. Immediately. Question 192. Fall prevention is the responsibility of: Option A, the entire staff. Option B, nursing assistants. Option C, housekeeping staff. Option D, nurses. The correct answer is option A, the entire staff. The entire staff. Question 193. Anti-rollback brakes on wheelchairs. Option A, reduces the risk of injury from falls. Option B, allow the resident to go faster. Option C, are a state requirement. Option D, should always be locked. The correct answer is option A, reduces the risk of injury from falls. Reduces the risk of injury from falls. Question 194. The goal of restraining a resident is to: Option A, reduce agitation. Option B, keep them safe. Option C, keep resident from falling. Option D, stop the resident from hitting others. The correct answer is option B, keep them safe. Keep them safe. Question 195. Thomas has a wrist restraint to prevent him from pulling out his fore. He complains to you that his hand is tingling. You should: Option A, do range of motion exercises. Option B, loosen the restraint and check him in 15 minutes. Option C. Massage the hand to reduce discomfort. Option D. Report his complaint to the nurse immediately. The correct answer is option D. Report his complaint to the nurse immediately. Report his complaint to the nurse immediately. Question 196. The nursing assistant needs to release a physical restraint. Option A. Every 2 hours to care for the resident's needs. Option B. Every 15 minutes to check the resident's skin. Option C. When the nurse instructs her to do so. Option D. If the resident does not give consent. The correct answer is option A. Every 2 hours to care for the resident's needs. Every 2 hours to care for the resident's needs. Question 197. An example of a restraint would be: Option A. Locking the wheelchair while you transfer a resident. Option B. Locking the bed in the lowest position. Option C. Placing a positioning device on the resident's bed. Option D. Locking the wheelchair while a resident eats his meal. The correct answer is option D. Locking the wheelchair while a resident eats his meal. Locking the wheelchair while a resident eats his meal. Question 198. Anaphylactic shock is A. Option A. Severe allergic reaction. Option B. Mild form of shock. Option C. Body response to a heart attack. Option D. Severe loss of blood. The correct answer is option A. Severe allergic reaction. Severe allergic reaction. Question 199. A nursing assistant is most likely to use a restraint in A.N. Option A. Long-term care facility. Option B. Assisted living facility. Option C. Emergency room. Option D. Respite care facility. The correct answer is option C. Emergency room. Emergency room. Question 200. Cardiac arrest occurs when: Option A. There is a temporary and sudden loss of consciousness. Option B. The heart cannot contract and pump blood. Option C. There is disrupted electrical activity within the brain. Option D. There is a partial or mild airway obstruction. The correct answer is option B. The heart cannot contract and pump blood. The heart cannot contract and pump blood. Question 201. A resident is at an increased risk for falls if he: Option A. Attends exercise class. Option B. Has a history of falls. Option C. Is over 75 years old. Option D. Drinks too much coffee. The correct answer is option B. Has a history of falls. Has a history of falls. Question 202. Esther has a seat belt on her wheelchair to prevent her from getting out of her wheelchair. When you help Esther with her supper, you should: Option A. Leave the belt on while she is eating. Option B. Release the belt but lock her wheelchair. Option C. Loosen the belt for comfort. Option D. Release the belt while she is supervised. The correct answer is option D. Release the belt while she is supervised. Release the belt while she is supervised. Question 203. An aura is: Option A. Always visual. Option B. The feeling or visual disturbance. Option C. The predictor of a heart attack. Option D. The result of low blood sugar. The correct answer is option B. A feeling or visual disturbance. A feeling or visual disturbance. Question 204. As a resident is falling, the nursing assistant must: Option A. Yell for another nursing assistant to help. Option B. Assist the resident to the floor while protecting the resident's head from injury. Option C. Stop the resident from falling by holding her up with the gait belt. Option D. Let go of the resident to prevent injuring herself. The correct answer is option B. Assist the resident to the floor while protecting the resident's head from injury. Assist the resident to the floor while protecting the resident's head from injury. Question 205. Syncope is the same as: Option A. Poisoning. Option B. Heart attack. Option C. Fainting. Option D. Bleeding. The correct answer is option C. Fainting. Fainting. Question 206. A full thickness burn. Option A. Involves only the dermis and epidermis. Option B. Presents as blisters. Option C. May not hurt initially. Option D. Is very sensitive. The correct answer is option C. May not hurt initially. May not hurt initially. Question 207. You are assisting a resident in the dining room. While he is eating, he starts to cough. The best response is to: Option A. Allow him to keep coughing. Option B. Dial 911. Option C. Start abdominal thrusts immediately. Option D, leave the resident to go get the nurse. The correct answer is option A, allow him to keep coughing. Allow him to keep coughing. Question 208. Restraints used while a resident is in bed should be fastened with A. Option A, quick release knot to the side rails. Option B, quick release knot to the bed frame. Option C, safety knot to the bed frame. Option D, safety knot to the side rails. The correct answer is option B, quick release knot to the bed frame. Quick release knot to the bed frame. Question 209. Annabelle is a resident with dementia who has been yelling and hitting staff when they try to help her get dressed. You are worried that she might hurt someone. To prevent an injury, you should: Option A, apply a wrist restraint while giving care. Option B, work slowly and quietly. Option C, provide care only when she asks. Option D, put all the bed's side rails up. The correct answer is option B, work slowly and quietly. Work slowly and quietly. Question 210. An extreme loss of blood and fluid can result in: Option A, hypovolemic shock. Option B, anaphylactic shock. Option C, a severe allergic reaction. Option D, cardiogenic shock. The correct answer is option A, hypovolemic shock. Hypovolemic shock. Question 211. The treatment for tuberculosis, TB, includes: Option A, a long-term medication regimen. Option B, eliminating triggers that cause attacks. Option C, placing the resident on bed rest. Option D, maintaining a low-fat diet. The correct answer is option A, a long-term medication regimen. A long-term medication regimen. Question 212. Red blood cells in the human body. Option A, defend the body from different types of infections. Option B, carry oxygen to areas of the body. Option C, target parasites and fungi. Option D, help blood clot after an injury. The correct answer is option B, carry oxygen to areas of the body. Carry oxygen to areas of the body. Question 213. A resident who is no longer able to speak, perform any ADLS, or control body movements is exhibiting signs of: Option A, the mild or early stage of Alzheimer's. Option B, the moderate or middle stage of Alzheimer's. Option C, the severe or late stage of Alzheimer's. Option D, sundowning. The correct answer is option C, the severe or late stage of Alzheimer's. The severe or late stage of Alzheimer's. Question 214. You have called the nurse to your resident's room because he is complaining of chest pain. He also appears sweaty and anxious and is holding his left arm. The resident may be experiencing a: Option A, cardiovascular accident. Option B, myocardial infarction. Option C, asthmatic attack. Option D, transient ischemic attack. The correct answer is option B, myocardial infarction. Myocardial infarction. Question 215. The integumentary system is made up of: Option A, blood, cells, sweat, and hair. Option B, skin, hair, sweat glands, and fingernails. Option C, toenails, teeth, blood, and sugar. Option D, organs, cells, vitamins, and minerals. The correct answer is option B, skin, hair, sweat glands, and fingernails. Skin, hair, sweat glands, and fingernails. Question 216. Normal signs of aging include: Option A, slowed response time. Option B, temperature regulation changes. Option C, vision changes. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 217. Changes in the respiratory system due to aging include: Option A, decreased air exchange in the lungs. Option B, increase in varicose veins. Option C, slower response time to pain. Option D, bone becoming brittle and breaking more easily. The correct answer is option A, decreased air exchange in the lungs. Decreased air exchange in the lungs. Question 218. The type of tissue only found in the integumentary system is: Option A, matrix. Option B, smooth. Option C, epithelial. Option D, nervous. The correct answer is option C, epithelial. Epithelial. Question 219. Janice is an older resident who has been asking to go to the bathroom nearly every hour. She has also had some incontinent episodes. which is unusual for her. She has no complaints of pain, but you notice that her urine is cloudy and smells. You suspect that Janice may have option A, a kidney stone, option B, a urinary tract infection, option C, diverticulitis, option D, atherosclerosis. The correct answer is option B, a urinary tract infection. A urinary tract infection. Question 220. A common sign of a cerebrovascular accident is option A, flat effect, option B, one-sided weakness, option C, red, swollen joints, option D, increased cough. The correct answer is option B, one-sided weakness. One-sided weakness. Question 221. A gradual thinning of bone tissue is called option A, kyphosis, option B, rheumatoid arthritis, option C, contracture, option D, osteoporosis. The correct answer is option D, osteoporosis. Osteoporosis. Question 222. A tissue type that lines the inside and outside of the body is called option A, matrix, option B, smooth, option C, epithelial, option D, nervous. The correct answer is option C, epithelial. Epithelial. Question 223. Platelets are fragments of cells that help the body to option A, fight infection, option B, clot after an injury, option C, maintain temperature, option D, maintain fluid balance. The correct answer is option B, clot after an injury. Clot after an injury. Question 224. Maurice is one of your residents whom you are taking care of today. When you enter his room, you notice that he is shaking and appears anxious. His skin is sweaty and cool when you touch him. He seems confused when you ask if he is feeling all right. Maurice may be experiencing option A, hyperglycemia, option B, hallucinations, option C, hypoglycemia, option D, peripheral vascular disease. The correct answer is option C, hypoglycemia. Hypoglycemia. Question 225. A common way to keep wandering residents safe is by using an option A, restraint, option B, microchip, option C, GPS, option D, alarm system. The correct answer is option D, alarm system. Alarm system. Question 226. The inability to speak or form words is called option A, receptive aphasia, option B, hemiplegia, option C, expressive aphasia, option D, dyspnea. The correct answer is option C, expressive aphasia. Expressive aphasia. Question 227. You have been assigned to take care of an older woman with Parkinson's disease. Symptoms you might expect to see include option A, hand tremors and slowed body movements, option B, red, swollen, and painful joints, option C, fever, cough, and night sweats, option D, frequent urination and fruity breath. The correct answer is option A, hand tremors and slowed body movements. Hand tremors and slowed body movements. Question 228. Side effects associated with cancer treatments include option A, fatigue, option B, weight loss, option C, mouth sores, option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 229. Respite care can be offered in the form of option A, adult day care, option B, assisted living, option C, skilled nursing care, option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 230. Stage 1 cancer is option A, small or slow growing, option B, the large tumor confined to one area, option C, the large tumor that has spread to a different area of the body, option D, none of the above. The correct answer is option A, small or slow growing. Small or slow growing. Question 231. Increased swelling in the legs, frequent urination at night, and shortness of breath are common symptoms of option A, peripheral vascular disease, option B, chronic pulmonary obstructive disease, option C, congestive heart failure, option D, diabetes mellitus. The correct answer is option C, congestive heart failure. Congestive heart failure. Question 232. A modifiable risk factor that greatly increases the risk of developing cancer is Option A, a high BMI. Option B, the low BMI. Option C, high blood pressure. Option D, the genetic predisposition. The correct answer is option A, a high BMI. A high BMI. Question 233. The CDC encourages healthcare providers to make HIV testing a part of care for. Option A, residents in high-risk categories only. Option B, residents in healthcare professions only. Option C, all residents 13 to 64 years old. Option D, only high-risk residents 13 to 64 years old. The correct answer is option C, all residents 13 to 64 years old. All residents 13 to 64 years old. Question 234. The most common type of dementia is Option A, vascular. Option B, Lewy body. Option C, Alzheimer's. Option D, Parkinson's. The correct answer is option C, Alzheimer's. Alzheimer's. Question 235. A good way to decrease pocketing food in the cheeks during mealtime is to Option A, use sippy cups. Option B, use rubber-tipped spoons. Option C, offer a drink in between each bite. Option D, offer finger foods. The correct answer is option C, offer a drink in between each bite. Offer a drink in between each bite. Question 236. A good way to increase caloric intake for a resident receiving cancer treatments is to offer Option A, fresh fruits and vegetables. Option B, large portions of calorie-heavy foods like cream sauces and fatty meats. Option C, ice cream, smoothies, and protein shakes. Option D, popsicles, fruit juice, and tea. The correct answer is option C, ice cream, smoothies, and protein shakes. Ice cream, smoothies, and protein shakes. Question 237. The type of therapy that helps a resident feel a sense of purpose and boosts self-esteem by bringing back a sense of meaning is Option A, reminiscence. Option B, activity. Option C, validation. Option D, sensory stimulation. The correct answer is option D, sensory stimulation. Sensory stimulation. Question 238. One of your residents appears nervous and states that he has an appointment for a biopsy. This means that he has an appointment for Option A, the removal of a small number of cells. Option B, a type of cancer treatment. Option C, the loss of hair. Option D, the type of radiation. The correct answer is option A, the removal of a small number of cells. The removal of a small number of cells. Question 239. Jonathan is a resident who has dementia. He wanders throughout the facility and often strikes out at the nursing assistant caring for him. An appropriate area for him to live would be A.N. Option A, locked unit. Option B, subacute unit. Option C, integrated unit. Option D, step-down unit. The correct answer is option A, locked unit. Locked unit. Question 240. You are assigned to bathe Kathleen, a dementia resident who is afraid of the water. You should Option A, wash the resident's hair at the end of the bath. Option B, offer a complete bed bath instead of a tub bath. Option C, be calm and supportive. Option D, do all of the above. The correct answer is option D, do all of the above. Do all of the above. Question 241. The number of people in the United States currently infected with HIV is Option A, 60,000. Option B, 100,000. Option C, 500,000. Option D, more than 1 million. The correct answer is option D, more than 1 million. More than 1 million. Question 242. The number one risk factor for developing dementia is Option A, age. Option B, genetics. Option C, brain injury. Option D, smoking. The correct answer is option A, age. Age. Question 243. The disease that is commonly referred to as the silent killer is Option A, hypotension. Option B, myocardial infarction. Option C, cerebrovascular accident. Option D, hypertension. The correct answer is option D, hypertension. Hypertension. Question 244. One example of sensory stimulation therapy might be Option A, giving the resident a hand massage. Option B, talking about the resident's family. Option C, helping the resident play bingo. Option D, assisting the resident during a fishing trip. The correct answer is option A, giving the resident a hand massage. Giving the resident a hand massage. Question 245. You work at a local nursing home as a nursing assistant. One of your residents has fallen while trying to self-transfer. In order to activate EMS, you should: option A, contact the administrator. Option B, call for the charge nurse. Option C, dial 911 and wait for the ambulance. Option D, call the nearest emergency room. The correct answer is option B, call for the charge nurse. Call for the charge nurse. Question 246. Alopecia is a loss of: option A, appetite. Option B, hair. Option C, self-esteem. Option D, a weight. The correct answer is option B, hair. Hair. Question 247. The function of the body's T cells is to: option A, carry oxygen to the cells of the body. Option B, help blood to clot. Option C, help the body fight off infections. Option D, provide proteins needed for cell health. The correct answer is option C, help the body fight off infections. Help the body fight off infections. Question 248. The goal of activities therapy is to: option A, maintain a resident's hobbies and interests. Option B, keep residents busy throughout the day. Option C, maintain the resident's ability to care for herself. Option D, restore gross motor skills. The correct answer is option A, maintain a resident's hobbies and interests. Maintain a resident's hobbies and interests. Question 249. A symptom that a resident is likely to have in the early stages of an HIV infection would be: option A, yeast infections. Option B, visual disturbances. Option C, Kaposi's sarcoma. Option D, night sweats. The correct answer is option A, yeast infections. Yeast infections. Question 250. According to Erik Erikson, the life stage at which people typically wish to contribute to the next generation is: option A, middle adult. Option B, senior. Option C, young adult. Option D, adolescence. The correct answer is option A, middle adult. Middle adult. Question 251. The clinic where you work discovers that one of its employees has tested positive for HIV. The clinic can legally share this information with: option A, the employee's residents. Option B, the physicians. Option C, the employee's doctor. Option D, no one. The correct answer is option D, no one. No one. Question 252. An intervention that can help a resident feel safe would be: option A, pushing the resident in a wheelchair. Option B, providing the call light before you leave the room. Option C, taking the resident to the restroom on a schedule. Option D, shutting off the lights at night. The correct answer is option B, providing the call light before you leave the room. Providing the call light before you leave the room. Question 253. The incidence of HIV infection in healthcare workers is low because: option A, HIV testing is standard for all residents. Option B, standard precautions are routinely used. Option C, facilities have post-exposure procedures. Option D, healthcare workers are routinely tested for HIV. The correct answer is option B, standard precautions are routinely used. Standard precautions are routinely used. Question 254. The greatest risk factor for contracting the HIV infection is: option A, unprotected sex between men. Option B, drug use with contaminated needles. Option C, unprotected sex between heterosexual couples. Option D, receiving blood transfusions. The correct answer is option A, unprotected sex between men. Unprotected sex between men. Question 255. Asking a resident what she wants to eat today is a good example of meeting her need for: option A, safety. Option B, love and belonging. Option C, self-actualization. Option D, esteem. The correct answer is option D, esteem. Esteem. Question 256. The term esteem refers to: option A, a person's full potential. Option B, establishing good relationships. Option C, respect or admiration for self and others. Option D, meeting basic human needs. The correct answer is option C, respect or admiration for self and others. Respect or admiration for self and others. Question 257. A preschooler has met his developmental milestone when: Option A, he trusts the primary caregivers. Option B, long-term relationships are started. Option C, he learns new skills and principles. Option D, he wants to contribute to the next generation. The correct answer is option C, he learns new skills and principles. He learns new skills and principles. Question 258. Anna is a 28-year-old home health resident whom you assist once a week. She is positive for HIV. Today she tells you that her infection has progressed to AIDS. This means that her life expectancy is: Option A, 6 months. Option B, 1 year. Option C, 2 to 3 years. Option D, 5 to 7 years. The correct answer is option C, 2 to 3 years. 2 to 3 years. Question 259. You are caring for Luis, a resident admitted to the hospital for pneumonia. He tells you that he is positive for HIV. This was not a part of the report you received from the nurse. You should: Option A, check his medical chart for information. Option B, report Luis's statement to the nurse. Option C, ask his family if this new information is correct. Option D, tell your coworkers to wear gloves and isolation gowns when entering the room. The correct answer is option B, report Luis's statement to the nurse. Report Luis's statement to the nurse. Question 260. In Maslow's hierarchy of needs, the level that addresses the social, creative, emotional, and spiritual potential within a person is: Option A, self-actualization. Option B, esteem. Option C, love and belonging. Option D, physiological. The correct answer is option A, self-actualization. Self-actualization. Question 261. Signs and symptoms of an anaphylactic reaction include: Option A, bleeding and confusion. Option B, an unsafe rise in blood pressure and pulse. Option C, shock, shortness of breath, wheezing, and facial and airway swelling. Option D, dizziness, lack of appetite, and nausea. The correct answer is option C, shock, shortness of breath, wheezing, and facial and airway swelling. Shock, shortness of breath, wheezing, and facial and airway swelling. Question 262. Assisting the resident with range of motion exercises can help: Option A, prevent contractures. Option B, improve comfort. Option C, reduce the risk of atrophy. Option D, do all of the above. The correct answer is option D, do all of the above. Do all of the above. Question 263. You can assist the independent resident with exercise or ambulation by: Option A, using verbal encouragement. Option B, being close during ambulation. Option C, using a gait belt during ambulation and movement. Option D, doing nothing. You do not need to assist an independent resident. The correct answer is option A, using verbal encouragement. Using verbal encouragement. Question 264. You are performing range of motion exercises for a resident who has a weakened right arm and leg. One of the required movements on the resident's care plan is abduction. This means: Option A, increasing the joint angle. Option B, moving away from the midline of the body. Option C, moving toward the midline of the body. Option D, moving the foot so that the toes are pointing downward. The correct answer is option B, moving away from the midline of the body. Moving away from the midline of the body. Question 265. The first step in a resident's physical therapy is: Option A, an evaluation by the nurse. Option B, the therapist determines the resident's goals. Option C, an evaluation by the physical therapist. Option D, the therapist designs a plan of care. The correct answer is option C, an evaluation by the physical therapist. An evaluation by the physical therapist. Question 266. The physical therapist works mostly on: Option A, swallowing difficulties. Option B, restorative efforts. Option C, fine motor skills. Option D, gross motor skills. The correct answer is option D, gross motor skills. Gross motor skills. Question 267. The person responsible for maintaining a resident's level of ability through range of motion exercises is the: Option A, occupational therapist. Option B, nursing assistant. Option C, licensed practical nurse. Option D, respiratory therapist. The correct answer is option B, nursing assistant. Nursing assistant. Question 268. You notice that one of your residents is having difficulties at mealtime. She has trouble swallowing her fluids and coughs with each bite. The person who could best help her would be the Option A, occupational therapist. Option B, restorative aide. Option C, speech-language pathologist. Option D, a physical therapist. The correct answer is option C, speech-language pathologist. Speech-language pathologist. Question 269. Gail is an older resident who uses a wheelchair to move about the facility. You encourage her to ambulate with you, but she often refuses. You should: Option A, encourage her to walk in her room. Option B, inform the nurse that Gail no longer walks. Option C, tell Gail that she needs to ambulate at least twice a day. Option D, refer her to the physical therapist. The correct answer is option A, encourage her to walk in her room. Encourage her to walk in her room. Question 270. Assisting a resident with ambulation can decrease the resident's risk of Option A, constipation. Option B, arthritis. Option C, diarrhea. Option D, nausea. The correct answer is option A, constipation. Constipation. Question 271. An intervention often used to relieve the pain and swelling associated with acute injuries is Option A, an ice pack. Option B, the topical ointment. Option C, ambulation. Option D, exercise. The correct answer is option A, an ice pack. An ice pack. Question 272. Properly sized crutches should have a space between the resident's underarms and the crutch that measure. Option A, 0 inches. Option B, 1 inch. Option C, 2 inches. Option D, 3 inches. The correct answer is option C, 2 inches. 2 inches. Question 273. The nursing assistant should lock the resident's wheelchair when she is Option A, ambulating the resident down the hallway. Option B, assisting the resident with a quad cane. Option C, transferring the resident from the bed to a wheelchair. Option D, placing the resident at the dining room table. The correct answer is option C, transferring the resident from the bed to a wheelchair. Transferring the resident from the bed to a wheelchair. Question 274. John is a 50-year-old resident who is working on ambulation and fine motor control in his hands following a motorcycle accident. Those involved in his therapy might include Option A, an occupational therapist. Option B, his wife and children. Option C, the physical therapist. Option D, both A and C. The correct answer is option D, both A and C. Both A and C. Question 275. Exercise and ambulation are essential to the residents. Option A, self-esteem. Option B, musculoskeletal health. Option C, digestive health. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 276. Your resident has Parkinson's disease and is quite shaky at mealtimes. The best device to help the resident maintain independence during meals is Option A, a cup with handles. Option B, the cup with a lid and handles. Option C, the nosy cup. Option D, a regular coffee cup. The correct answer is option B, a cup with a lid and handles. A cup with a lid and handles. Question 277. A nosy cup is used for the resident who Option A, cannot tilt his head back to drink. Option B, has a hand tremor. Option C, does not have good wrist flexion. Option D, cannot open his mouth adequately. The correct answer is option A, cannot tilt his head back to drink. Cannot tilt his head back to drink. Question 278. Your resident uses a hand splint. When you take the splint off to clean it, you see a small crack in the splint where the index finger rests against it. The best response is to Option A, take the splint to the nurse for repair. Option B, place soft cloths between the splint and the skin. Option C, put a small amount of glue in the crack. Option D, wash the splint with mild soap and water. The correct answer is option A, take the splint to the nurse for repair. Take the splint to the nurse for repair. Question 279. Tay recently had a hip replacement. His doctor told him that he cannot bend at the hip greater than 90 degrees. An adaptive tool that would help him to care for himself at home would be Option A, a shoehorn. Option B, the elastic shoelaces. Option C, the long-handled bath sponge. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 280. IADL activities might include learning how to. Option A, walk with a prosthetic leg. Option B, cook supper with a broken arm. Option C, wash yourself following a stroke. Option D, climb stairs safely. The correct answer is option B, cook supper with a broken arm. Cook supper with a broken arm. Question 281. You are walking with Mrs. Stewart when she begins limping and grimacing in pain. She refuses to walk any further and states that she thinks she hurt her foot this morning. The subjective data to report to the nurse is that Mrs. Stewart, option A, is experiencing foot pain. Option B, stated that she hurt herself. Option C, is refusing to walk. Option D, was limping during her walk. The correct answer is option A, is experiencing foot pain. Is experiencing foot pain. Question 282. The abbreviation for the phrase as needed is option A, N. Option B, PRN. Option C, PN. Option D, ASN. The correct answer is option B, PRN. PRN. Question 283. A visitor to your facility becomes angry and starts yelling, using foul language, and upsetting the residents. After making sure that you and your residents are safe, you should fill out a N. Option A, disturbance document. Option B, accident report. Option C, accident recording sheet. Option D, incident report. The correct answer is option D, incident report. Incident report. Question 284. The commonly used abbreviation for nothing by mouth is option A, NBM. Option B, NPM. Option C, NPO. Option D, OBM. The correct answer is option C, NPO. NPO. Question 285. Resident information that needs to be documented includes option A, urinary output. Option B, refusing activities. Option C, signs of depression. Option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 286. The term 4 times a day is commonly abbreviated as option A, QID. Option B, QHS. Option C, 4D. Option D, QOD. The correct answer is option A, QID. QID. Question 287. Thinking you know a resident's food preferences is an example of being option A, subjective. Option B, factual. Option C, unbiased. Option D, objective. The correct answer is option A, subjective. Subjective. Question 288. The term proximal means option A, toward the front side of the body. Option B, the side of the body. Option C, away from the midline of the body. Option D, the nearer of 2 points on the body. The correct answer is option D, the nearer of 2 points on the body. The nearer of 2 points on the body. Question 289. Mottling is most likely to appear on the residents. Option A, chest. Option B, abdomen. Option C, legs and feet. Option D, face. The correct answer is option C, legs and feet. Legs and feet. Question 290. Nervous system changes that take place during the dying process include all of the following except option A, twitching movements. Option B, decreased alertness. Option C, hallucinations. Option D, loss of hearing. The correct answer is option D, loss of hearing. Loss of hearing. Question 291. You are assisting with postmortem care, you must follow option A, medical asepsis and surgical ASPs. Option B, sterile technique and isolation precautions. Option C, standard precautions and the bloodborne pathogen standard. Option D, the care plan. The correct answer is option C, standard precautions and the bloodborne pathogen standard. Standard precautions and the bloodborne pathogen standard. Question 292. Postmortem care is done to option A, prevent rigor mortis. Option B, prevent the skin from changing color. Option C, maintain a good appearance of the body. Option D, clean the body. The correct answer is option C, maintain a good appearance of the body. Maintain a good appearance of the body. Question 293. You have noticed that your resident has been breathing very rapidly and shallowly, followed by slow, deep breaths. The resident is showing signs of Option A, molting. Option B, death rattle. Option C, Cheyne-Stokes breathing. Option D, low blood pressure. The correct answer is option C, Cheyne-Stokes breathing. Cheyne-Stokes breathing. Question 294. An advance directive is Option A, the care plan. Option B, an order not to resuscitate the person. Option C, a document stating a person's wishes about health care when that person cannot make such decisions. Option D, a document stating the person's wishes about life support measures. The correct answer is option C, a document stating a person's wishes about health care when that person cannot make such decisions. A document stating a person's wishes about health care when that person cannot make such decisions. Question 295. You are caring for a resident who is in the last stages of dying. Today, when you speak to him, he doesn't respond. You should. Option A, continue to talk to him in a normal tone of voice. Option B, raise your voice until he responds to you. Option C, call the family to update them of this change. Option D, take out his hearing aids and give them to his family. The correct answer is option A, continue to talk to him in a normal tone of voice. Continue to talk to him in a normal tone of voice. Question 296. After a resident dies, the nurse's responsibilities include Option A, listening for a heartbeat and updating the doctor. Option B, pronouncing the time of death. Option C, asking the family to call their funeral director. Option D, tidying up the resident's room. The correct answer is option A, listening for a heartbeat and updating the doctor. Listening for a heartbeat and updating the doctor. Question 297. According to Dr. Elizabeth Kubler-Ross, the 5 stages of dying are Option A, denial, pain, sadness, bargaining, and acceptance. Option B, denial, pain, acceptance, hospice, and death. Option C, denial, anger, bargaining, depression, and acceptance. Option D, denial, anger, sadness, hospice, and acceptance. The correct answer is option C, denial, anger, bargaining, depression, and acceptance. Denial, anger, bargaining, depression, and acceptance. Question 298. You are caring for Dorian, a 58-year-old resident who is dying of prostate cancer. Today, when you are assisting Dorian with his breakfast, he coughs with each bite and shakes his head. You should. Option A, continue to offer him his breakfast. Option B, stop, ensure that he is safe, and then update the nurse. Option C, give him only his fluids until he is on longer coughing. Option D, tell him that he won't feel better unless he eats something. The correct answer is option B, stop, ensure that he is safe, and then update the nurse. Stop, ensure that he is safe, and then update the nurse. Question 299. The nursing assistant should provide oral care for a resident who is dying. Option A, each time you reposition her. Option B, 2 or 3 times a day. Option C, every 15 minutes. Option D, only when the resident requests. The correct answer is option A, each time you reposition her. Each time you reposition her. Question 300. Edna is a resident who is dying of a respiratory disease. She tells you that she is Catholic and would like to have a priest come visit her. The appropriate action to take is to Option A, call the family and ask them to contact Edna's church. Option B, look in Edna's chart for more information. Option C, tell your facility's social worker right away. Option D, update the nurse with Edna's request. The correct answer is option D, update the nurse with Edna's request. Update the nurse with Edna's request. Question 301. You are caring for Faith, a resident who is dying of kidney failure. Her family has been keeping a vigil at the bedside. Tonight, they seem especially upset and start shouting at each other while still in Faith's room. After making sure Faith is safe, the first thing you should do is Option A, ask the family members to leave the facility. Option B, dial 911 and report the emergency. Option C, immediately report the nurse for directives. Option D, ask the nurse if a counselor is available. The correct answer is option C, immediately report the nurse for directives. Immediately report the nurse for directives. Question 302. You are caring for Eva when she tells you that her brother has just died of cancer. She states that if her brother's doctor would have caught it faster, he would still be alive. The stage of grief that Eva is most likely experiencing is Option A, acceptance. Option B, denial. Option C, bargaining. Option D, anger. The correct answer is Option C, bargaining. Bargaining. Question 303. One of your residents is not doing well. He received a very upsetting diagnosis from his doctor this morning. His daughter comes in to visit and asks you why her father seems so sad today. The best response is to Option A, tell the daughter what happened since she is family. Option B, not answer in order to protect the resident's privacy. Option C, inform the daughter to call the resident's doctor about his diagnosis. Option D, suggest that the daughter discuss it with the resident. The correct answer is Option D, suggest that the daughter discuss it with the resident. Suggest that the daughter discuss it with the resident. Question 304. OSHA regulations help protect the Option A, resident's individual health information. Option B, healthcare worker. Option C, long-term care resident. Option D, healthcare facility. The correct answer is Option B, healthcare worker. Healthcare worker. Question 305. Of the following persons, the one most vulnerable and at risk of abuse would be A. Option A, 17-year-old high school boy. Option B, 9-month-old baby girl. Option C, 23-year-old college student. Option D, a 40-year-old married woman. The correct answer is Option B, 9-month-old baby girl. 9-month-old baby girl. Question 306. Older residents may be at risk of abuse because they Option A, often don't recognize abuse when it happens. Option B, strike out at others. Option C, may fear losing their caregiver. Option D, have little control over their actions. The correct answer is Option C, may fear losing their caregiver. May fear losing their caregiver. Question 307. Mr. Peterson often leaves the dining table after only eating a few bites of food. One of your coworkers decides to put his wheelchair between the wall and table so he stays and eats. This is an example of Option A, abandonment. Option B, physical abuse. Option C, defamation. Option D, a false imprisonment. The correct answer is Option D, false imprisonment. False imprisonment. Question 308. One example of assault might be Option A, telling a resident he may lie down only after he eats lunch. Option B, not answering a resident's call light. Option C, leaving an immobile resident in a locked chair. Option D, leaving the facility before your replacement arrives. The correct answer is Option A, telling a resident he may lie down only after he eats lunch. Telling a resident he may lie down only after he eats lunch. Question 309. The term battery refers to Option A, a time when a caregiver doesn't follow her scope of practice. Option B, physically touching another person without their permission. Option C, a purposeful action meant to harm another. Option D, threatening a resident with physical harm. The correct answer is Option B, physically touching another person without their permission. Physically touching another person without their permission. Question 310. The willful infliction of injury that results in physical harm is Option A, defamation. Option B, battery. Option C, assault. Option D, abuse. The correct answer is Option D, abuse. Abuse. Question 311. You are taking care of a resident who speaks only Spanish. Since it is difficult to explain your actions to her, you should Option A, ask your supervisor for a different assignment. Option B, tell the resident's family that they will need to interpret. Option C, ask the nurse if the facility has a translator available. Option D, raise your voice when speaking and point at items. The correct answer is Option C, ask the nurse if the facility has a translator available. Ask the nurse if the facility has a translator available. Question 312. David is a resident who lives in a local nursing home. He recently has become upset with the staffing, feeling that he must wait a very long time for someone to answer his call light and he isn't able to go to bed until late at night. He has spoken to the facility's director of nurses, but he is still unhappy with his care. The next step that David should take is to Option A, contact the volunteer ombudsman. Option B, file a complaint with the Department of Public Health. Option C, submit a complaint to the Joint Commission. Option D, refuse to pay for services received. The correct answer is option A, contact the volunteer ombudsman. Contact the volunteer ombudsman. Question 313. If a nurse delegates a routine nursing task to a nursing aide, the person who is legally accountable for the patient's safety? Option A, delegating nurse. Option B, nurse aide. Option C, supervisor. Option D, director of nursing. The correct answer is option A, delegating nurse. Delegating nurse. Question 314. How far should a slide sheet extend? Option A, at least from above the head to below the feet. Option B, at least from the upper back to the hips. Option C, at least from under the head to above the knees. Option D, at least from the waist to below the hips. The correct answer is option C, at least from under the head to above the knees. At least from under the head to above the knees. Question 315. If a patient has just had a long leg plaster cast applied and the cast is still damp, what should the nurse aide do? Option A, move the cast using the fingerprints only. Option B, ensure that the cast is exposed to the air. Option C, cover the cast with a blanket. Option D, avoid pillows under the cast until it's dry. The correct answer is option B, ensure that the cast is exposed to the air. Ensure that the cast is exposed to the air. Question 316. If, when assisting a patient to undress, the nurse aide notes bruising and behavior that suggest a patient may be a victim of abuse, what should the nurse aide do? Option A, ask the patient about it. Option B, stay quiet because there is no proof. Option C, report the concerns to the nurse. Option D, provide the patient with the number of an abuse hotline. The correct answer is option C, report the concerns to the nurse. Report the concerns to the nurse. Question 317. If planning to use a mechanical lift to move a patient who weighs more than 500 pounds, what is the first thing the nurse aide should do? Option A, get assistance from another staff member. Option B, ensure that the equipment is in good repair. Option C, explain the procedure to the patient. Option D, check the weight limit for the equipment. The correct answer is option D, check the weight limit for the equipment. Check the weight limit for the equipment. Question 318. What is true for contact precautions? Option A, gloves are worn for all contact with the patient and the immediate environment. Option B, the patient's bed must be separated from another patient's bed by at least 6 feet. Option C, the patient's privacy curtain has to be closed only during procedures. Option D, the same personal protective equipment PPE may be used if caring for 2 patients in the same room. The correct answer is option A, gloves are worn for all contact with the patient and the immediate environment. Gloves are worn for all contact with the patient and the immediate environment. Question 319. What site is used to check the pulse of a 1-year-old child? Option A, temporal. Option B, radial. Option C, brachial. Option D, apical. The correct answer is option D, apical. Apical. Question 320. After helping a patient onto the toilet, what should be done next? Option A, watch until the patient finishes. Option B, allow the patient privacy. Option C, stay close but turn away from the patient. Option D, cover the patient's lap with a drape. The correct answer is option B, allow the patient privacy. Allow the patient privacy. Question 321. When collecting a stool specimen from a patient, what part of the stool should be collected? Option A, any part of the stool. Option B, any abnormal appearing part of the stool. Option C, the middle of the stool and any blood, mucus, or abnormality. Option D, the end of the stool and any blood, mucus, or abnormally. The correct answer is option C, the middle of the stool and any blood, mucus, or abnormality. The middle of the stool and any blood, mucus, or abnormality. Question 322. If a patient is to use a cane because of weakness in the left leg, how should the cane be held? Option A, with the tip 12 to 15 inches to the side of the foot. Option B, in either hand that is comfortable. Option C, in the left hand. Option D, in the right hand. The correct answer is option D, in the right hand. In the right hand. Question 323. If the nurse aide notes that a coworker has spilled water in the hallway when delivering it to a patient, What should a nurse aide do? Option A. Wait until the coworker comes back out and tell the person. Option B. Wipe up the spilled water. Option C. Call housekeeping to wipe up the water. Option D. Tell the nurse that there is spilled water in the hallway. The correct answer is option B. Wipe up the spilled water. Wipe up the spilled water. Question 324. If a patient repeatedly asks the nurse aide to repeat what the nurse aide said and turns the volume of the TV up high, what should the nurse aide suspect? Option A. The patient is hard of hearing. Option B. The patient is confused. Option C. The patient is distracted. Option D. The patient is unhappy. The correct answer is option A. The patient is hard of hearing. The patient is hard of hearing. Question 325. When changing the linen on a bed, it's important to do which of the following? Option A. Shake out the sheets to remove any wrinkles. Option B. Bring extra linen in case they are needed. Option C. Avoid touching the linen to one's uniform. Option D. Place the dirty linen on the floor. The correct answer is option C. Avoid touching the linen to one's uniform. Avoid touching the linen to one's uniform. Question 326. If a nurse aide needs help from another team member in caring for a patient, an appropriately worded request is? Option A. Can you help me with room 26A? Option B. Can you please help me turn Mrs. Brown in room 26A for about 5 minutes at 8:30? Option C. I need help turning Mrs. Brown, can you do it? Option D. Meet me in room 26A at 8:30. I need help with the patient. The correct answer is option B. Can you please help me turn Mrs. Brown in room 26A for about 5 minutes at 8:30? Can you please help me turn Mrs. Brown in room 26A for about 5 minutes at 8:30? Question 327. A patient complains of pain in the left leg. What should the nurse aide do? Option A. Palpate the leg to determine where the pain is. Option B. Ask the patient to point to the painful areas. Option C. Ask the patient which part of the leg hurts. Option D. Ask the patient to move the leg around to see if that relieves the pain. The correct answer is option B. Ask the patient to point to the painful areas. Ask the patient to point to the painful areas. Question 328. If a bedbound patient is agitated, angry, and threatening, which of the following should the nurse aide do? Option A. Run out of the room. Option B. Tell the patient that the behavior is unacceptable. Option C. Stand away from the patient and near the door. Option D. Yell for help. The correct answer is option C. Stand away from the patient and near the door. Stand away from the patient and near the door. Question 329. A resident in a long-term care facility has the right to do which of the following? Option A. Bring any personal items that the patient desires. Option B. Refuse to allow a roommate in a double room. Option C. Swear at all staff members. Option D. Make complaints about the quality of care. The correct answer is option D. Make complaints about the quality of care. Make complaints about the quality of care. Question 330. Which of the following is an appropriate documentation of a patient's state of mind? Option A. Patient crying throughout the morning and refused visitors. Option B. Patient sad and depressed all morning. Option C. Patient increasingly withdrawn. Option D. Patient appears very down and wants no contact with others. The correct answer is option D. Patient appears very down and wants no contact with others. Patient appears very down and wants no contact with others. Question 331. A patient is undergoing bladder training to reduce urinary frequency. What does this mean for the patient? Option A. The patient should urinate when feeling the urge. Option B. The patient should delay urinating for as long as possible. Option C. The patient should urinate every hour. Option D. The patient should urinate on a schedule. The correct answer is option D. The patient should urinate on a schedule. The patient should urinate on a schedule. Question 332. A patient scattered personal belongings around the room and bathroom, resulting in a cluttered space. The nurse aide should do which of the following? Option A. Clean up the clutter. Option B. Explain that the room looks cluttered. Option C. Ask the patient for permission to organize the personal belongings. Option D. Remind the patient to organize the personal belongings. The correct answer is option C. Ask the patient for permission to organize the personal belongings. Ask the patient for permission to organize the personal belongings. Question 333. When assisting a patient with mild Alzheimer's disease to dress, what should the nurse aide do? Option A. Stack the clothing in the order that the pieces are normally worn. Option B. Point out the clothing items one by one as the patient dresses. Option C. Lay out all the clothing separately. Option D. Hand the patient one piece of clothing at a time. The correct answer is option A. Stack the clothing in the order that the pieces are normally worn. Stack the clothing in the order that the pieces are normally worn. Question 334. The nurse aide is caring for a home healthcare patient when the patient's phone rings, and the patient asks the nurse to answer the phone. Which of the following is an appropriate telephone greeting? Option A. Hello, Mrs. Brown's residence. Option B. Hello. Option C. Hello, this is Mrs. Brown's home health aide. Option D. Hello, this is Sally Smith, a home health aide. The correct answer is option C. Hello, this is Mrs. Brown's home health aide. Hello, this is Mrs. Brown's home health aide. Question 335. When preparing a surgical/postoperative bed, what is true of the top linens? Option A. They are folded toward the foot. Option B. They are left off of the bed. Option C. They include extra blankets. Option D. They are folded to one side of the bed. The correct answer is option D. They are folded to one side of the bed. They are folded to one side of the bed. Question 336. A patient asks the nurse aide to explain the purpose of a new medical treatment. Which of the following would be the most appropriate response? Option A. I'll ask your nurse to come in and explain that to you. Option B. I can't give you that information. Option C. The purpose is to reduce your episodes of chest pain. Option D. I don't know what the purpose of the treatment is. The correct answer is option A. I'll ask your nurse to come in and explain that to you. I'll ask your nurse to come in and explain that to you. Question 337. If a male patient uses a urinal while in bed, where should the urinal be? Option A. Placed under the covers beside the person. Option B. Placed on a bedside stand next to the bed. Option C. Placed on the overbed table within easy reach. Option D. Attached to a bedrail or urinal holder on a bedrail. The correct answer is option D. Attached to a bedrail or urinal holder on a bedrail. Attached to a bedrail or urinal holder on a bedrail. Question 338. What should the nurse aide use to cut a patient's fingernails? Option A. Clippers. Option B. Scissors. Option C. Clippers and a nail file. Option D. Scissors and a nail file. The correct answer is option C. Clippers and a nail file. Clippers and a nail file. Question 339. When transferring a patient from a wheelchair, WC, to a toilet, which of the following is true regarding positioning? Option A. Position the patient's weak side closest to the toilet. Option B. Position the WC so it is directly in front of the toilet. Option C. Position the WC so it is beside or at a 90-degree angle to the toilet. Option D. Position the patient onto the toilet before loosening the clothing. The correct answer is option C. Position the WC so it is beside or at a 90-degree angle to the toilet. Position the WC so it is beside or at a 90-degree angle to the toilet. Question 340. When clearing the mouth of an unconscious patient, what should the nurse aide use? Option A. A water pick. Option B. The sponge swab. Option C. The soft cloth. Option D. The soft toothbrush. The correct answer is option B. A sponge swab. A sponge swab. Question 341. If a nurse aide turns a patient and discovered that the area over the bone prominence of the right hip is red and irritated, the nurse aide should do which of the following? Option A. Report this observation to the nurse. Option B. Massage the area. Option C. Apply the lotion to the area. Option D. Apply a warm compress to the area. The correct answer is option A. Report this observation to the nurse. Report this observation to the nurse. Question 342. If a patient's hair is badly tangled and matted, what should the nurse aide do? Option A. Apply hair conditioner to the hair before brushing. Option B. Cut out the tangled and matted hair. Option C. Brush the hair from the scalp to the hair ends. Option D. Brush the hair from the hair ends to the scalp. The correct answer is option D. Brush the hair from the hair ends to the scalp. Brush the hair from the hair ends to the scalp. Question 343. If a nurse aide student is going to observe the nurse aide giving a bed bath to a patient, the nurse aide should do which of the following? Option A. Ask the patient's permission in advance. Option B. Tell the patient in advance. Option C. Explain that observation is a standard procedure. Option D. Pretend that the student is a mother nurse aide on the unit. The correct answer is option A. Ask the patient's permission in advance. Ask the patient's permission in advance. Question 344. After bathing a patient, which of the following is used to help prevent friction from two skin surfaces rubbing against each other? Option A. Bath oil. Option B. Lotion. Option C. Powder. Option D. Cream. The correct answer is option C. Powder. Powder. Question 345. If assisting a patient to brush the teeth, the head of the patient's bed should be elevated to what position? Option A. 75 to 90 degrees. Option B. 45 to 60 degrees. Option C. 30 to 45 degrees. Option D. 20 to 30 degrees. The correct answer is option A. 75 to 90 degrees. 75 to 90 degrees. Question 346. With 24-hour time, how is 3 p.m. recorded? Option A. 3 o'clock. Option B. 30:00. Option C. 1:50. Option D. 1500 hours. The correct answer is option D. 1500 hours. 1500 hours. Question 347. If a patient refuses personal care early in the morning, stating "I'm not a morning person," what should the nurse aide do? Option A. Skip personal care. Option B. Ask the patient when the personal care would be convenient. Option C. Insist on providing the personal care. Option D. Report the patient to the nurse. The correct answer is option B. Ask the patient when the personal care would be convenient. Ask the patient when the personal care would be convenient. Question 348. Which term is used to describe difficulty swallowing? Option A. Dysphagia. Option B. Dystonia. Option C. Dyspepsia. Option D. Dyspnea. The correct answer is option A. Dysphagia. Dysphagia. Question 349. What is the correct temperature for the water in a basin bed for a complete or partial bed bath for a patient? Option A. 98 to 101 degrees. Option B. 102 to 106 degrees. Option C. 107 to 110 degrees. Option D. 110 to 115 degrees. The correct answer is option D. 110 to 115 degrees. 110 to 115 degrees. Question 350. If a patient is on a dysphagia diet because of the risk of choking, at least how long should the patient remain sitting upright after eating? Option A. 20 minutes. Option B. 40 minutes. Option C. 60 minutes. Option D. 90 minutes. The correct answer is option C. 60 minutes. 60 minutes. Question 351. If a nurse asks the nurse aide to deliver a medication to a patient, the nurse aide should do which of the following? Option A. Deliver the medication. Option B. Explain that the nurse aide is not allowed to administer medication. Option C. Ask what the medication is for before administering it. Option D. Make an excuse for you the nurse aide does not have time. The correct answer is option B. Explain that the nurse aide is not allowed to administer medication. Explain that the nurse aide is not allowed to administer medication. Question 352. Which position is recommended to prevent pressure injuries? Option A. 30 degrees lateral. Option B. Prone. Option C. Full lateral. Option D. Sims. The correct answer is option A. 30 degrees lateral. 30 degrees lateral. Question 353. If the patient's care plan states turn patient Q2H, what does this mean? Option A. Turn the patient 2 times per shift. Option B. Turn the patient every 2 hours. Option C. Turn the patient with 2 people. Option D. Turn the patient with the bed in the high position. The correct answer is option B. Turn the patient every 2 hours. Turn the patient every 2 hours. Question 354. If a patient has a feeding tube, the nurse aide may do which of the following? Option A. Reinsert the feeding tube that has been displaced. Option B, check the feeding tube placement. Option C, assist with feedings. Option D, aspirate to determine the residual stomach contents. The correct answer is option C, assist with feedings. Assist with feedings. Question 355. Which of the following is true for lifting a box from the floor? Option A, keep the back straight and bend at the knees. Option B, bend over at the waist. Option C, use the muscles of the back rather than the legs for lifting. Option D, hold the box away from the body. The correct answer is option A, keep the back straight and bend at the knees. Keep the back straight and bend at the knees. Question 356. If the nurse aide observes another staff member going through a patient's personal belongings and pocketing an item when the patient is out of the room, what should the nurse aide do? Option A, assume it is at the patient's request. Option B, confront the staff member. Option C, ignore the situation. Option D, report the observation to a supervisor. The correct answer is option D, report the observation to a supervisor. Report the observation to a supervisor. Question 357. If the patient's skin sticks to the sheet when the patient slides down in bed, this is referred to as which of the following? Option A, friction. Option B, shearing. Option C, tearing. Option D, deranging. The correct answer is option B, shearing. Shearing. Question 358. How should a transfer belt be applied? Option A, over bare skin. Option B, very loosely. Option C, when the patient is in a sitting position. Option D, with the buckle centered in the front. The correct answer is option C, when the patient is in a sitting position. When the patient is in a sitting position. Question 359. If a patient who weighs 210 pounds must be repositioned toward the head of the bed but can only partially assist with the repositioning, how many staff members are needed? Option A, 1 to 2. Option B, 2 to 3. Option C, 3 to 4. Option D, 4 to 6. The correct answer is option C, 3 to 4. 3 to 4. Question 360. If the patient's door is closed when the nurse aide arrives to give morning care, what should the aide do? Option A, enter quietly so as not to disturb the patient. Option B, knock before entering the room. Option C, assume that the patient does not want to be disturbed. Option D, return at a later time. The correct answer is option B, knock before entering the room. Knock before entering the room. Question 361. What is the most effective way to prevent the spread of healthcare-associated infections, such as Clostridium difficile or methicillin-resistant Staphylococcus aureus? Option A, wear face mask. Option B, wear gown when in patients' rooms. Option C, limit time with patients. Option D, use proper hand hygiene. The correct answer is option D, use proper hand hygiene. Use proper hand hygiene. Question 362. When washing the hands with soap and water, the nurse aide should be lather the hands for at least how long? Option A, 30 seconds. Option B, 20 seconds. Option C, 10 seconds. Option D, 5 seconds. The correct answer is option B, 20 seconds. 20 seconds. Question 363. Which of the following is part of a safety check? Option A, ensuring that adaptive devices are stored in a closet or cabinet. Option B, ensuring that the bed is locked in the high position. Option C, ensuring that hearing aids are sent home so they don't get lost. Option D, ensuring that the patient's water and call bell are within reach. The correct answer is option D, ensuring that the patient's water and call bell are within reach. Ensuring that the patient's water and call bell are within reach. Question 364. If a patient has violent restraints in place, what is the minimum frequency they must be checked on? Option A, 5 minutes. Option B, 15 minutes. Option C, 30 minutes. Option D, 60 minutes. The correct answer is option B, 15 minutes. 15 minutes. Question 365. The nurse aide is taking routine vital signs for a 70-year-old patient. Which of the following should immediately be reported to the nurse? Option A, BP 176/100. Option B, pulse 68. Option C, respirations 14. Option D, temperature 38 degrees Celsius. The correct answer is option A, BP 176/100. BP 176/100. Question 366. If a patient is being monitored for intake and output and drinks 6 ounces of apple juice, what is this equal to? Option A, 90 ml. Option B, 120 ml. Option C, 180 ml. Option D, 240 ml. The correct answer is option C, 180 ml. 180 ml. Question 367. If a sign on a patient's door says NPO, what does this mean? Option A, the patient is not to be disturbed. Option B, the patient is non-ambulatory. Option C, the patient is non-hearing. Option D, the patient is to have nothing by mouth. The correct answer is option D, the patient is to have nothing by mouth. The patient is to have nothing by mouth. Question 368. What is the normal range for an oral temperature? Option A, 96.6 to 98.6 degrees Fahrenheit. Option B, 97.6 to 99.6 degrees Fahrenheit. Option C, 98.6 to 100.6 degrees Fahrenheit. Option D, 100.4 to 102.2 degrees Fahrenheit. The correct answer is option B, 97.6 to 99.6 degrees Fahrenheit. 97.6 to 99.6 degrees Fahrenheit. Question 369. If a patient is to maintain abduction after a left hip replacement, how should the patient be positioned? Option A, with the legs apart. Option B, with the legs closed together. Option C, with the left leg elevated. Option D, with the knee flexed on the left leg. The correct answer is option A, with the legs apart. With the legs apart. Question 370. Which of the following is true for the nurse aide when carrying out range of motion, ROM, exercises? Option A, move the joint to the point of pain. Option B, force the joint slightly past its normal range. Option C, move the joint slowly and gently. Option D, move the joint quickly and forcefully. The correct answer is option C, move the joint slowly and gently. Move the joint slowly and gently. Question 371. A person dying of cancer is withdrawn and refusing food, stating, "What's the point?" Which of the following is the most appropriate response? Option A, I know how you feel. Option B, if you'd like to talk, I'll listen. Option C, try to concentrate on the good things in your life. Option D, you may still have week of life ahead if you'd eat. The correct answer is option B, if you'd like to talk, I'll listen. If you'd like to talk, I'll listen. Question 372. A Muslim patient has been admitted to a long-term care facility and is nonverbal after a stroke. What should the nurse aide anticipate that the patient will probably want to avoid eating? Option A, beef. Option B, fish. Option C, poultry. Option D, pork. The correct answer is option D, pork. Pork. Question 373. What type of precautions should the nurse aide use in caring for a patient who is human immunodeficiency virus, HIV, positive? Option A, contact. Option B, standard. Option C, droplet. Option D, airborne. The correct answer is option B, standard. Standard. Question 374. The CNA is caring for a client who is experiencing an infection with C. difference. Which of the following should be used when caring for this client? Option A, gown and gloves. Option B, gown, gloves, and N95 respirator. Option C, gown, gloves, surgical mask, and face shield. Option D, gloves and surgical mask. The correct answer is option A, gown and gloves. Gown and gloves. Question 375. The CNA is assisting a client to shower. Which of the following should be completed prior to bringing the client into the shower? Option A, test the water temperature. Option B, apply skin lotion to the client's heels and bottoms of feet to soften calluses. Option C, have the client take off their clothes and wrap them in a blanket for the trip down the unit hallway. Option D, turn the water to the hottest setting. The correct answer is option A, test the water temperature. Test the water temperature. Question 376. Upon entering a room, the CNA finds a client who is not responsive. What should the CNA do next? Option A, telephone the family contact. Option B, close the curtain around the bed to maintain privacy. Option C, call for help. Option D, page the doctor on call. The correct answer is option C, call for help. Call for help. Question 377. The CNA is caring for a client who is on precautions for MRSA. Which of the following precautions should the CNA utilize? Option A, droplet precautions. Option B, neutropenic precautions. Option C, contact precautions. Option D, respiratory precautions. The correct answer is option C, contact precautions. Contact precautions. Question 378. The care plan for a client indicates they should be repositioned every 2 hours when in bed. Which of the following is the rationale for this nursing intervention? Option A, increase client comfort. Option B, provide the opportunity to check in with the client. Option C, decrease fall risk. Option D, prevent skin breakdown. The correct answer is option D, prevent skin breakdown. Prevent skin breakdown. Question 379. An immobile client requires transfer from a chair to their bed. Which of the following should the CNA utilize to transfer the client? Option A, gait belt. Option B, a physical assist of 1. Option C, contact guard assist. Option D, a mechanical lift. The correct answer is option D, mechanical lift. Mechanical lift. Question 380. You are assisting a new client to reposition from bed to chair. You have not previously assisted this client and are uncertain regarding their need for assistance to complete the transfer process. Which of the following should be done to ensure safety of the client and staff? Option A, ask an additional staff member to assist. Option B, ask the family to assist. Option C, use an assist of 1 and a standard walker. Option D, use a mechanical lift. The correct answer is option A, ask an additional staff member to assist. Ask an additional staff member to assist. Question 381. A resident that usually loves going to bingo game nights is sitting in her room crying. She states that she does not want to go to bingo tonight. What is your response to her? Option A, okay, you don't have to go. Maybe another night. Option B, why don't you want to go? All of your friends are there. Option C, there are going to be a lot of fun prizes. You should go. Option D, it's okay if you don't want to go, but do you want to talk about why you don't want to go to bingo? The correct answer is option D, it's okay if you don't want to go, but do you want to talk about why you don't want to go to bingo? It's okay if you don't want to go, but do you want to talk about why you don't want to go to bingo? Question 382. You and a coworker are charting on the computer. Your coworker gets up and walks away without logging off of the computer. What is this an example of? Option A, negligence. Option B, defamation. Option C, HIPAA violation. The correct answer is option C, HIPAA violation. Malpractice. Question 383. C. HIPAA violation. You have a patient that has received bad news about her husband. Before reaching out to hold her hand, what should you consider? Option A, what race the patient is. Option B, what is the patient's cultural background. Option C, whether the patient has psychological health issues. Option D, whether the patient is crying or not. The correct answer is option B, what is the patient's cultural background. What is the patient's cultural background? Question 384. You are feeding a patient with dementia when another patient with dementia makes a sexual pass at the patient you are feeding. What is your response? Option A, report it to the charge nurse because a patient with dementia cannot give consent. Option B, ask the patient that made the pass not to do it again. Option C, allow the patients to engage in conversation because they have a right to fulfill sexual desires. Option D, ask the patients to only have this conversation in private and not in the dining area. The correct answer is option A, report it to the charge nurse because a patient with dementia cannot give consent. Report it to the charge nurse because a patient with dementia cannot give consent. Question 385. You witnessed a patient fall and are reporting what happened to the nurse in charge. You should. Option A, state facts only. Option B, give your opinion on what may have caused the fall. Option C, be sure to chart that the patient had a fall in the patient's chart. Option D, call the patient's family to report the fall since you witnessed it. The correct answer is option A, state facts only. State facts only. Question 386. When should universal precautions be practiced? Option A, for all client encounters. Option B, when the client has an open wound. Option C, when the client has a fever. Option D, when the client has a cough. The correct answer is option A, for all client encounters. For all client encounters. Question 387. A patient consumes 8 ounces of ice chips. What amount should be recorded on the intake log? Option A, 8 milliliters. Option B, 240 milliliters. Option C, 120 milliliters. Option D, 180 milliliters. The correct answer is option C, 120 milliliters. 120 milliliters. Question 388. The CNA is aware that the long-term care resident may resort to manipulation of the staff. The CNA recognizes manipulation as what behavior? Option A, constant complaints of pain or discomfort each time a new staff member is on their unit. Option B, lying to the other residents on their unit. Option C, refusal to take medications. Option D, sitting alone for all meals. The correct answer is option A, constant complaints of pain or discomfort each time a new staff member is on their unit. Constant complaints of pain or discomfort each time a new staff member is on their unit. Question 389. It is estimated that delirium is noted in at least 40% of nursing home residents in the United States. The CNA is aware the resident with delirium might suffer from what symptom? Option A, resident becomes tearful and upset at small changes in schedule. Option B, resident sees or hears things that other residents and staff do not. Option C, resident becomes weaker and experiences episodes of incontinence. Option D, resident loses the ability to speak. The correct answer is option B, resident sees or hears things that other residents and staff do not. Resident sees or hears things that other residents and staff do not. Question 390. A patient has fallen and broken his foot. The foot is now in a cast. What is important to assess during your shift? Option A, color and temperature of the toes. Option B, color and temperature of the knee above the cast. Option C, pulse behind the knee. Option D, pulse in the groin. The correct answer is option A, color and temperature of the toes. Color and temperature of the toes. Question 391. You have a patient that has incontinence who wears briefs. What is necessary for patients with stress incontinence? Option A, a Foley catheter to keep the skin dry. Option B, frequent toileting breaks throughout the day. Option C, less fluids to keep them from urinating often. Option D, diuretics to help keep their bladder empty. The correct answer is option B, frequent toileting breaks throughout the day. Frequent toileting breaks throughout the day. Question 392. You have a patient that has fallen on the floor. What is the first thing you should do? Option A, assess the patient for injuries. Option B, leave the patient and go tell the charge nurse. Option C, help the patient up to a chair as soon as possible. Option D, make the patient roll onto their left side. The correct answer is option A, assess the patient for injuries. Assess the patient for injuries. Question 393. What is the medical abbreviation for before meals and at bedtime? Option A, ACHS. Option B, BID. Option C, BM. Option D, BMAB. The correct answer is option A, ACHS. ACHS. Question 394. You have a patient on strict dysphagia precautions. The cafeteria sent her up a lunch tray. What item would you question if it arrived on the patient's tray? Option A, regular orange juice. Option B, mashed potatoes. Option C, Jell-O. Option D, applesauce. The correct answer is option A, regular orange juice. Regular orange juice. Question 395. You have a patient with dark, amber-colored urine. You know this is a sign of what? Option A, impending heart attack. Option B, dehydration. Option C, kidney stone. Option D, impending death. The correct answer is option B, dehydration. Dehydration. Question 396. You have a patient that does not drink adequate fluids. The patient is at risk for all of the following except: Option A, mouth sores. Option B, bad breath. Option C, skin ulcers. Option D is swollen gums. The correct answer is option D, swollen gums. Swollen gums. Question 397. You are assisting a resident in shaving his face. Which of the following is a correct step in shaving the face? Option A, shaving upward on the neck. Option B, when shaving the chin, an upward motion should be used. Option C, use long strokes when shaving. Option D, rinse the blade every 2 to 3 strokes. The correct answer is option A, shaving upward on the neck. Shaving upward on the neck. Question 398. You have a patient experiencing dysphagia and must be on a dysphagia diet. You are assisting the patient with feeding. What type of diet would you expect this patient to be on? Option A, pureed. Option B, clear liquid. Option C, a mechanical soft. Option D, a regular. The correct answer is option C, mechanical soft. Mechanical soft. Question 399. A patient's care plan states that he is a two-person assist and must use a Hoyer lift. Which transfer are you most likely making with the Hoyer lift? Option A, from the bedside commode to the chair. Option B, from the bed to the bathtub. Option C, from the wheelchair to the shower. Option D, from the bed to the stationary chair. The correct answer is option D, from the bed to the stationary chair. From the bed to the stationary chair. Question 400. A resident wants a copy of their medical records. The CNA should: Option A, make a copy of the record and give it to them. Option B, inform them that copies cannot be given to residents directly. Option C, notify the resident's family about the request. Option D, provide the record release forms and advise the supervisor. The correct answer is option Nan. Question 401. Two unmarried residents are cuddling in a common area. The CNA should: Option A, separate them. Option B, escort them to one of the residents' private rooms. Option C, notify their families. Option D, allow them to enjoy each other's company. The correct answer is option D, allow them to enjoy each other's company. Allow them to enjoy each other's company. Question 402. If another staff member hides the call bell from the resident who frequently uses it even though nothing is needed, the CNA should: Option A, be grateful because there is no time to answer the call bell so often. Option B, give the resident a fake call bell. Option C, tell the resident someone will visit every hour to see if she really needs something. Option D, return the call bell within reach of the resident and report the staff member for neglect. The correct answer is option D, return the call bell within reach of the resident and report the staff member for neglect. Return the call bell within reach of the resident and report the staff member for neglect. Question 403. One factor that can influence the grieving process is the cause of death. What impact can this have on the grieving process? Option A, the cause of death has no bearing on the grieving process. Option B, the cause of death brings up bad memories. Option C, death often reminds us of our past losses and how that individual passed. Option D, none of the above. The correct answer is option C, death often reminds us of our past losses and how that individual passed. Death often reminds us of our past losses and how that individual passed. Question 404. Your patient is nearing death and you notice they are grimacing a lot and look as if they are in pain. What can you do to assist this patient and relieve their pain? Option A, ask the nurse to administer pain medications. Option B, do nothing as they are dying. Option C, place pillows around and under the resident. Option D, ask the patient what you can do to relieve their pain. The correct answer is option A, ask the nurse to administer pain medications. Ask the nurse to administer pain medications. Question 405. How many fingers should you be able to slide under wrist restraints? Option A, 1. Option B, 0. Option C, 2. Option D, 4. The correct answer is option C, 2. 2. Question 406. You have a 70-year-old patient that is usually pleasant and easygoing. Today she has cognitive delays, is hitting and kicking, and does not know who the staff are. Which condition is the patient likely experiencing? Option A, urinary tract infection. Option B, headache. Option C, sinus infection. Option D, hunger. The correct answer is option A, urinary tract infection. Urinary tract infection. Question 407. You have a patient with generalized weakness to transfer from the bed to the chair. Which transfer device do you use? Option A, Hoyer lift. Option B, the sit-to-stand lift. Option C, the sliding board. Option D, a gait belt. The correct answer is option D, a gait belt. A gait belt. Question 408. A resident states they wish their life would end. The CNA knows. Option A, elderly people say things like that and don't mean it. Option B, it is impossible to harm oneself in a long-term care facility. Option C, the resident needs help even if they don't mean it. Option D, residents have the right to harm themselves if they want. The correct answer is option C, the resident needs help even if they don't mean it. The resident needs help even if they don't mean it. Question 409. You have a patient that only seems to become confused and agitated after dark. What is the patient most likely experiencing? Option A, dementia. Option B, Alzheimer's. The correct answer is option Nan. Question 410. C. Sundowner's syndrome. D. Psychosis. C. Sundowner's syndrome. You have a patient that had a fall. You must write an incident report. What is the reason for an incident report? Option A, to show patterns and trends and to prevent further incidents. Option B, to see who is at fault for the incident. Option C, to show the doctor how weak the patient is. Option D, to keep a record for the family members. The correct answer is option A, to show patterns and trends and to prevent further incidents. To show patterns and trends and to prevent further incidents. Question 411. Which of the following medical abbreviations is inappropriate for use? Option A, TID for 3 times a day. Option B, BID for 2 times a day. Option C, QD for daily. Option D, NPO for nothing by mouth. The correct answer is option C, QD for daily. QD for daily. Question 412. Which of the following is the best way to prevent the spreading of germs? Option A, wearing gloves during patient care. Option B, wearing a mask and gloves with patient care. Option C, hand washing before and after patient care. Option D, wearing a gown, mask, and gloves while performing patient care. The correct answer is option C, hand washing before and after patient care. Hand washing before and after patient care. Question 413. Which of the following happens when a patient has a stroke? Option A, the patient urinates themselves. Option B, the patient may foam at the mouth. Option C, the patient may roll their eyes back. Option D, the patient may have drooping of one side of the face. The correct answer is option D, the patient may have drooping of one side of the face. The patient may have drooping of one side of the face. Question 414. The patient that is B-bound is at risk for which of the following? Option A, dysphagia. Option B, polydipsia. Option C, atrophy. Option D, impaction. The correct answer is option C, atrophy. Atrophy. Question 415. You have a patient in restraints. You know the proper place to always tie restraints to is where? Option A, the bed frame. Option B, the upper bed rail. Option C, the lower bed rail. Option D, the head of the bed. The correct answer is option A, the bed frame. The bed frame. Question 416. Which of the following would require contact precautions? Option A, TB. Option B, COVID-19. Option C, pneumonia. Option D, MRSA. The correct answer is option D, MRSA. MRSA. Question 417. You have a patient who is sweating, has a low heart rate, fruity-smelling breath, and can barely speak to you. What is the next step you would take? Option A, obtain a POC glucose. Option B, bring the patient 24 ounces of orange juice. Option C, turn the air on in the patient's room. Option D, ask the patient to brush their teeth. The correct answer is option A, obtain a POC glucose. Obtain a POC glucose. Question 418. You are using a pulse oximeter on a patient. You know a pulse oximeter is used to measure what? Option A, the amount of O2 in the patient's blood. Option B, the amount of CO2 in the patient's blood. Option C, the amount of CO2 in the patient's lungs. Option D, the amount of O2 in the patient's heart. The correct answer is option A, the amount of O2 in the patient's blood. The amount of O2 in the patient's blood. Question 419. You see your diabetic patient is sweating, disoriented, and unable to speak. What is the first thing you would assess? Option A, temperature. Option B, pupil. Option C, pulse. Option D, glucose. The correct answer is option D, glucose. Glucose. Question 420. In relation to the recent outbreaks of COVID that have affected long-term care facilities, the CNA is aware that what problem has acutely risen with the residents? Option A, feelings of isolation from family and friends. Option B, feelings of worry related to death by COVID. Option C, feeling scared because the staff is in isolation attire. Option D, feelings of anger about not understanding COVID precautions. The correct answer is option A, feelings of isolation from family and friends. Feelings of isolation from family and friends. Question 421. Which of these are important for the care of a diabetic patient? Option A, giving the patient a heating pad for his feet when they're cold. Option B, soaking his dry calloused feet in a warm tub daily. Option C, keep his feet dry and warm with dry, clean socks. Option D, ensuring his toenails are always clipped short for cleanliness. The correct answer is option C, keep his feet dry and warm with dry, clean socks. Keep his feet dry and warm with dry, clean socks. Question 422. What is the proper measurement for measuring bodily fluids? Option A, ounces. Option B, liters. Option C, milliliters. Option D, fluid ounces. The correct answer is option C, milliliters. Milliliters. Question 423. You have a patient that has pneumonia and is weak. What teaching would you provide to the patient? Option A, make sure to cough and deep breathe often throughout the day. Option B, be sure to keep your liquid intake to 600 cubic centimeters per day. Option C, be sure to exercise your arms by doing range of motion multiple times a day. The correct answer is option A, make sure to cough and deep breathe often throughout the day. Make sure to cough and deep breathe often throughout the day. Question 424. A client has a confirmed case of influenza. The CNA would anticipate using which infection control precautions when caring for this client? Option A, contact precautions. Option B, respiratory precautions. Option C, reverse precautions. Option D, bloodborne exposure precautions. The correct answer is option B, respiratory precautions. Respiratory precautions. Question 425. You have a patient in soft wrist restraints. You must check the wrist restraints per the doctor's orders to ensure the patient's safety. Failure to do this can result in charges for Option A, neglect. Option B, aiding and abetting. Option C, false documentation. Option D, incidental harm. The correct answer is option A, neglect. Neglect. Question 426. The CNA measures the blood pressure of a client to be 200/180. The client is not in distress. What should the CNA do next? Option A, ensure the blood pressure cuff used is the correct size and repeat the measurement. Option B, record the measurement in the record and continue with the assignment. Option C, immediately notify the nursing supervisor. Option D, measure the client's temperature and pulse to complete the vitals set. The correct answer is option A, ensure the blood pressure cuff used is the correct size and repeat the measurement. Ensure the blood pressure cuff used is the correct size and repeat the measurement. Question 427. You have been busy during your 12-hour shift and haven't been able to empty your patient's Foley bag. You go in right before your shift is over to document output. What output amount would bring caution? Option A, 1000 ml. Option B, 600 ml. Option C, 2100 ml. Option D, 350 ml. The correct answer is option D, 350 ml. 350 ml. Question 428. The CNA is aware that attention-seeking behaviors in the nursing home resident may include all of the following except Option A, going to every social event in the nursing home. Option B, refusing to visit with their family. Option C, excessive use of the call light. Option D, refusing to go to therapy. The correct answer is option A, going to every social event in the nursing home. Going to every social event in the nursing home. Question 429. The CNA is aware of common mental health issues that are experienced by elderly adults. These may be brought on by all of the following situations except Option A, the death of a spouse. Option B, loss of financial independence. Option C, increasing health issues. Option D, faith-based group activities. The correct answer is option D, faith-based group activities. Faith-based group activities. Question 430. You have a patient who is incontinent of bowel and bladder. You know this patient is at increased risk for what? Option A, pressure wounds. Option B, dehydration. Option C, depression. Option D, anxiety. The correct answer is option A, pressure wounds. Pressure wounds. Question 431. If a resident is found crying in a common area, the CNA should: option A, guide the resident to a private area and ask what is wrong. Option B, give the resident privacy and leave them alone. Option C, tell them that others are being disturbed and ask the resident to leave the common area. Option D, call the resident's family. The correct answer is option A, guide the resident to a private area and ask what is wrong. Guide the resident to a private area and ask what is wrong. Question 432. A sometimes confused resident reports that something was taken from the room. The CNA should: option A, remind the resident that the item is not valuable. Option B, help the resident look for it. Option C, call the police. Option D, call the resident's power of attorney. The correct answer is option B, help the resident look for it. Help the resident look for it. Question 433. If a resident reports that a family member hurt them during a visit and insist it be kept a secret, the CNA should: option A, assure the resident that no one can hurt them. Option B, call the police. Option C, notify the nurse of supervisor. Option D, advise a different family member about the resident's report. The correct answer is option C, notify the nurse of supervisor. Notify the nurse of supervisor. Question 434. The CNA is assisting to turn a client who has a Foley catheter. Where should the Foley catheter be anchored to prevent pulling on the catheter? Option A, bed rail. Option B, upper thigh. Option C, lower thigh. Option D, a lateral aspect of knee. The correct answer is option B, upper thigh. Upper thigh. Question 435. The CNA is caring for a patient with an infection of C. diff. Which of the following would the CNA anticipate utilizing in caring for this client? Option A, surgical mask. Option B, N95 respirator. Option C, face shield. Option D, gown. The correct answer is option D, gown. Gown. Question 436. You have an infant that you are caring for on your unit. What is the most accurate way to retrieve a temperature on this patient? Option A, orally. Option B, rectally. Option C, temporally. Option D, axillary. The correct answer is option B, rectally. Rectally. Question 437. A fracture-type bedpan is used for patients with what condition? Option A, hip fracture. Option B, back injury. Option C, head injury. Option D, pelvic fracture. The correct answer is option B, back injury. Back injury. Question 438. You have a new 65-year-old diabetic patient on your unit. What is the most important thing to do before leaving the room? Option A, ensure that the patient is aware of how to use the call light system. Option B, ask if the patient is hungry. Option C, make sure the patient knows where the restroom is. Option D, ensure that the patient knows your name. The correct answer is option A, ensure that the patient is aware of how to use the call light system. Ensure that the patient is aware of how to use the call light system. Question 439. You are coming on shift to meet your patient. What is the best way to ensure patient safety while meeting the patient? Option A, having the patient tell you their name. Option B, checking the patient's chart. Option C, checking that the patient's name and room number are on the patient's door. Option D, have the patient tell you his name and DOB while you make sure it matches what is on his armband. The correct answer is option D, have the patient tell you his name and DOB while you make sure it matches what is on his armband. Have the patient tell you his name and DOB while you make sure it matches what is on his armband. Question 440. You are working a 12-hour shift. How often should you reposition your patients? Option A, Q3HR. Option B, Q4HR. Option C, Q2HR. Option D, Q1HR. The correct answer is option C, Q2HR. Q2HR. Question 441. What is the best way to palpate a carotid pulse? Option A. Place 2 fingers lightly at the front of the neck. Option B. Place 2 fingers lightly on the wrist. Option C. Place 2 fingers lightly on the side of the neck just underneath the mandible and over the trachea. Option D. Place 2 fingers lightly behind the knee. The correct answer is option C. Place 2 fingers lightly on the side of the neck just underneath the mandible and over the trachea. Place 2 fingers lightly on the side of the neck just underneath the mandible and over the trachea. Question 442. You are taking care of a patient with MRSA. You need to dispose of your gown and gloves. Where is the proper place to dispose of your gown and gloves? Option A. In the dirty utility room. Option B. In the trash can outside of the patient's room. Option C. In the patient's room. Option D. There is no need to discard the gown and gloves if you're treating multiple patients with MRSA. The correct answer is option C. In the patient's room. In the patient's room. Question 443. You are performing CPR on an adult patient. What is the correct depth per compression you should use? Option A. 1 inch. Option B. 2 inches. Option C. 1.5 to 2.5 inches. Option D. 2.5 to 5 inches. The correct answer is option B. 2 inches. 2 inches. Question 444. Which is the best way to take an apical pulse? Option A. To the right of the sternum underneath the clavicle. Option B. On the back at the 5th intercostal space. Option C. To the right of the sternum at the 5th intercostal space at the midclavicular line. Option D. To the left of the sternum at the 5th intercostal space at the midclavicular line. The correct answer is option D. To the left of the sternum at the 5th intercostal space at the midclavicular line. To the left of the sternum at the 5th intercostal space at the midclavicular line. Question 445. You are performing CPR with a second rescuer available to you. You are performing chest compressions. The second rescuer is giving oxygen via bag and mask. At what rate should the second rescuer provide breaths to the patient who is in cardiac arrest? Option A. 1 breath every 2 to 5 seconds. Option B. 1 breath every 5 to 6 seconds. Option C. 2 breaths every 10 seconds. Option D. 1 breath every 6 seconds. The correct answer is option D. 1 breath every 6 seconds. 1 breath every 6 seconds. Question 446. You have a patient with a reddened area on her coccyx. What is best practice to keep the area from becoming a stage 2 pressure ulcer? Option A. Washing it with soap and water. Option B. Turning the patient Q2HR and offloading pressure to the reddened area. Option C. Washing the area with alcohol to prevent germs. Option D. Be sure to check the area once every day to make sure it hasn't gotten worse. The correct answer is option B. Turning the patient Q2HR and offloading pressure to the reddened area. Turning the patient Q2HR and offloading pressure to the reddened area. Question 447. You are providing perineal care to a patient. What is the proper way to clean the patient to avoid contamination or UTI? Option A. Wash from the rectum to the meatus. Option B. Wash with change products only. Option C. Wash from the meatus out. Option D. Wash with alcohol-based products only. The correct answer is option C. Wash from the meatus out. Wash from the meatus out. Question 448. Which of the following are normal signs of aging? Option A. Incontinence. Option B. Losing balance. Option C. Memory loss. Option D. Slower response time. The correct answer is option D. Slower response time. Slower response time. Question 449. You assess your patient and he has a fever of 102.1, HR 101, RR 22. The patient appears sweaty. He most likely has what? Option A. An allergy to a medication. Option B. Upset stomach from something he ate. Option C. An infection. Option D. The migraine. The correct answer is option C. An infection. An infection. Question 450. All of the following should be ensured while assessing a patient's blood pressure except Option A. The patient's legs should be crossed. Option B. The patient should be sitting in an upright position or lying with feet at or below the level of the heart. Option C. The patient should not speak during the BIP check. Option D. The cuff should fit approximately 40% around the patient's arm. The correct answer is option A. The patient's legs should be crossed. The patient's legs should be crossed. Question 451. A patient is experiencing dark stools. Which of the following conditions is the patient likely experiencing? Option A, GI bleed. Option B, appendicitis. Option C, gastroenteritis. Option D, hepatitis. The correct answer is option A, GI bleed. GI bleed. Question 452. You are performing CPR on an adult patient. At what rate should you use to properly provide CPR? Option A, 100 to 120 compressions per minute. Option B, 60 to 100 compressions per minute. Option C, 80 to 120 compressions per minute. Option D, 120 to 160 compressions per minute. The correct answer is option A, 100 to 120 compressions per minute. 100 to 120 compressions per minute. Question 453. You have a patient that has a colostomy bag. You are changing the colostomy bag and realize the stoma is dark purple. What is your next step? Option A, nothing. This is a normal variation of the color of the stoma. Option B, report it immediately to the charge nurse. Option C, rub the stoma with a wet washcloth. Option D, leave the colostomy bag off for a couple of hours to allow oxygen to get to the stoma. The correct answer is option B, report it immediately to the charge nurse. Report it immediately to the charge nurse. Question 454. Which type of precautions would be used for a patient with C. diff? Option A, enteric. Option B, respiratory. Option C, droplet. Option D, standard. The correct answer is option A, enteric. Enteric. Question 455. You are going to help a patient transfer from the wheelchair to the bed. Where would you stand while transferring the patient? Option A, behind the wheelchair. Option B, in front of the wheelchair. Option C, to the left of the wheelchair. Option D, on the other side of the bed. The correct answer is option B, in front of the wheelchair. In front of the wheelchair. Question 456. A patient is experiencing a seizure. What is the proper thing to do? Option A, place a tongue depressor in the patient's mouth to keep from biting their tongue. Option B, lay them on their left side. Option C, sit them upright. Option D, slightly tug on the patient's tongue so that they don't swallow their tongue. The correct answer is option B, lay them on their left side. Lay them on their left side. Question 457. You are counting respirations on a patient. What is the proper way to count respirations for a patient? Option A, look at the chest rise for 10 seconds and multiply by 6. Option B, look at the patient's chest rise and a watch simultaneously for 60 seconds. Option C, use a stethoscope and count to 60. Option D, look at the chest rise for 30 seconds and multiply by 2. The correct answer is option B, look at the patient's chest rise and a watch simultaneously for 60 seconds. Look at the patient's chest rise and a watch simultaneously for 60 seconds. Question 458. Your patient has an indwelling Foley catheter. Where is the best place to position the drainage bag? Option A, above the bladder. Option B, at or below the bladder. Option C, behind the patient's head. Option D, at the foot of the bed. The correct answer is option B, at or below the bladder. At or below the bladder. Question 459. You have a patient who states that her left calf hurts. You assess it and it is red and warm to the touch. Which condition are you concerned that your patient may be suffering from? Option A, stroke. Option B, blood clot. Option C, sprain. Option D, cellulitis. The correct answer is option B, blood clot. Blood clot. Question 460. You have a patient on oxygen that wants to use his new electric shaver to shave his face. You know that. Option A, using an electric shaver is the safest way to shave a patient with oxygen. Option B, the patient using oxygen should only use a standard razor due to the risk of fire. Option C, using a standard razor for this patient is unsafe due to the risk of cutting the patient. Option D, it is unsafe for the patient on oxygen to use either an electric standard razor. The correct answer is option B. A patient using oxygen should only use a standard razor due to the risk of fire. A patient using oxygen should only use a standard razor due to the risk of fire. Question 461. The patient tells you his pain is 10/10. However, the patient is smiling and talking to his visitors. You report the pain to the charge nurse because you know that. Option A, the patient may get upset if you don't. Option B, the patient has a history of a drug problem and needs pain meds. Option C, pain is whatever the patient says it is. Option D, the patient isn't in pain but he wants medication so you should get it for him. The correct answer is option C, pain is whatever the patient says it is. Pain is whatever the patient says it is. Question 462. There is a fire on your unit. What is the first thing you should do? Option A, rescue your patients. Option B, get the fire extinguisher. Option C, call for help. Option D, evacuate the unit. The correct answer is option A, rescue your patients. Rescue your patients. Question 463. You have a patient that just received short-acting insulin 5 minutes ago for their morning dose. When should the patient eat their breakfast? Option A, ASAP. Option B, the patient should wait 30 minutes to allow the insulin to take effect. Option C, the patient cannot eat for another hour. Option D, the patient should wait 15 minutes to ensure the insulin reaches their bloodstream. The correct answer is option A, ASAP. ASAP. Question 464. You walk into a patient's room and the patient is unresponsive. What is your first step? Option A, call for help. Option B, check for a pulse. Option C, perform hand hygiene. Option D, start CPR. The correct answer is option B, check for a pulse. Check for a pulse. Question 465. You see your diabetic patient is sweating, disoriented, and unable to speak. What is the first thing you would assess? Option A, temperature. Option B, pupils. Option C, pulse. Option D, glucose. The correct answer is option D, glucose. Glucose. Question 466. Which of the following is true about side rails? Option A, one side rail on each side of the bed should be raised at all times. Option B, all 4 side rails at a time is safest for the patient. Option C, side rails only have to be raised if the patient is sleeping. Option D, only bed rails on one side of the bed should be raised at a time. The correct answer is option A. One side rail on each side of the bed should be raised at all times. One side rail on each side of the bed should be raised at all times. Question 467. You have a patient wanting to ambulate and walk around. You ask her to sit on the side of the bed for a few minutes before standing so that. Option A, you can get her walker for that. Option B, you can help her get dressed. Option C, to prevent orthostatic hypotension. Option D, that she can prepare her muscles to stand. The correct answer is option C, to prevent orthostatic hypotension. To prevent orthostatic hypotension. Question 468. A patient has edema in their lower extremities. When repositioning the patient, which position would you put the patient into aid in decreasing edema? Option A, semi-Fowlers with legs above the level of the heart. Option B, high Fowlers with the legs below the level of the heart. Option C, Sims position with the legs below the level of the heart. Option D, Trendelenburg with the feet above the level of the heart. The correct answer is option A, semi-Fowlers with legs above the level of the heart. Semi-Fowlers with legs above the level of the heart. Question 469. You are providing education to a female resident about proper perineal care to promote self-care. You explain to your patient that it is important to wipe from the front to the back to prevent bacteria from spreading from the rectum to the what? Option A, uvula. Option B, urinary meatus. Option C, cervix. Option D, uterus. The correct answer is option B, urinary meatus. Urinary meatus. Question 470. You have a patient that is on a bowel regimen but he has not had a bowel movement in 4 days. What is your next step? Option A, report this to the nurse in charge. Option B, give the patient orange juice with Miralax. Option C, encourage the patient to drink more water. Option D, nothing, this is normal. The correct answer is option A, report this to the nurse in charge. Report this to the nurse in charge. Question 471. You have a patient who usually takes longer than other patients to eat lunch. Her physical therapy sessions are after lunch. The physical therapist has stated that the patient is unable to complete her full 60 minutes of patient daily. What should you do? Option A. Explain to the physical therapist that the patient has a right to eat as long as she wants. Option B. Take the patient to lunch earlier so that she gets her full 60 minutes of patient. Option C. Report the physical therapist to the administrator. Option D. Tell the patient that you must assist her to eat quicker. The correct answer is option B. Take the patient to lunch earlier so that she gets her full 60 minutes of patient. Take the patient to lunch earlier so that she gets her full 60 minutes of patient. Question 472. Which of the following should be considered when providing hair care to residents? Option A. Age. Option B. Race and culture. Option C. Hygiene. Option D. Transfer status. The correct answer is option B. Race and culture. Race and culture. Question 473. Which of the following patients would you most likely use a soft tooth aide on? Option A. A patient with dentures to clean the gums. Option B. For a patient that has sore gums. Option C. For an unconscious patient. Option D. For a patient with dry mouth. The correct answer is option C. For an unconscious patient. For an unconscious patient. Question 474. You are assisting a patient with eating and know that the patient has orders for a clear liquid diet for a colonoscopy tomorrow. What would you expect to be on the patient's tray? Option A. Milk, tea, and soda. Option B. Water, coffee, and milk. Option C. Jello, Sprite, and broth. Option D. Soup, coffee, and tea. The correct answer is option C. Jello, Sprite, and broth. Jello, Sprite, and broth. Question 475. You have a patient that has had a stroke that has residual left-sided weakness. He asks you to assist him with dressing. How should you assist him? Option A. Help him dress by standing on his left side. Option B. Have the patient sit while you help him put his shirt on. Option C. Help him dress by standing on his right side. Option D. Have the patient lie down so you can assist him with his pants. The correct answer is option A. Help him dress by standing on his left side. Help him dress by standing on his left side. Question 476. You have a resident with Alzheimer's disease who is refusing to eat any of her dinner. What is your response to her? Option A. Your family wants you to eat. You should at least eat for them. Option B. The doctor will be upset if you don't eat. Option C. Tell the patient that it is unhealthy for her not to eat. Option D. I respect that you do not wish to eat, and report it to the nurse in charge. The correct answer is option D. I respect that you do not wish to eat, and report it to the nurse in charge. I respect that you do not wish to eat, and report it to the nurse in charge. Question 477. You are assisting a diabetic patient with eating and he only finished 25% of his meal. What should you do? Option A. Report this to the nurse in charge. Option B. Nothing. The patient may not be hungry. Option C. Tell the patient that you will try again at dinner. Option D. Chart the patient's meal. The nurse can see it in his chart. The correct answer is option A. Report this to the nurse in charge. Report this to the nurse in charge. Question 478. You have a patient that is mostly independent with her care and needs you as a standby assist. She is very slow at dressing and providing oral hygiene. How do you approach this? Option A. Ask her to let you help her get dressed more quickly because you have other patients to assist. Option B. Continue to be standby assist in case she needs your assistance. Option C. Ask her if she is able to get dressed a little more quickly so you can go assist your other patients. Option D. Ask her to start taking her showers on the opposite shift. The correct answer is option B. Continue to be standby assist in case she needs your assistance. Continue to be standby assist in case she needs your assistance. Question 479. After an elderly patient has a stroke and is discharged from the hospital, where might they go for continued care? Option A. Subacute care center. Option B. Hospice. Option C. Respite care facility. Option D. Group home. The correct answer is option A. Subacute care center. Subacute care center. Question 480. What information is typically included in nursing care plans? Option A. Medical diagnosis. Option B. Doctor's orders. Option C. Patient goals. Option D. Insurance information. The correct answer is option C, patient goals. Patient goals. Question 481. Which of the following tasks is outside the scope of practice for a CNA? Option A, taking a newborn's temperature. Option B, measuring blood pressure. Option C, filing toenails. Option D, dressing a surgical wound. The correct answer is option D, dressing a surgical wound. Dressing a surgical wound. Question 482. Which of these conditions is considered acute? Option A, paralysis. Option B, Alzheimer's disease. Option C, diabetes. Option D, pneumonia. The correct answer is option D, pneumonia. Pneumonia. Question 483. If a patient has had confusion for many years, this is likely a chronic. Option A, physical disorder. Option B, psychotic disorder. Option C, cognitive disorder. Option D, palliative disorder. The correct answer is option C, cognitive disorder. Cognitive disorder. Question 484. How does a long-term care facility primarily differ from a respite center? Option A, long-term care focuses only on physical care. Option B, long-term care provides extended care for residents. Option C, respite centers only offer outpatient services. Option D, long-term care excludes emotional care. The correct answer is option B, long-term care provides extended care for residents. Long-term care provides extended care for residents. Question 485. In a home care setting, CNAs typically work. Option A, only under a nurse's supervision. Option B, only with elderly patients. Option C, without any supervision. Option D, exclusively with terminally ill patients. The correct answer is option A, only under a nurse's supervision. Only under a nurse's supervision. Question 486. Who are the primary recipients of hospice care? Option A, children with genetic disorders. Option B, individuals at the end of life, regardless of age. Option C, young children needing surgeries. Option D, elderly patients. The correct answer is option B, individuals at the end of life, regardless of age. Individuals at the end of life, regardless of age. Question 487. Medicare is a healthcare program primarily for Option A, homeless children. Option B, programs that provide food to the elderly. Option C, low-income individuals. Option D, government-funded healthcare for certain groups. The correct answer is option D, government-funded healthcare for certain groups. Government-funded healthcare for certain groups. Question 488. CNAs are not allowed to apply which of the following? Option A, antibiotic ointment. Option B, blood pressure cuffs. Option C, body lotion to feet. Option D, denture care. The correct answer is option A, antibiotic ointment. Antibiotic ointment. Question 489. After completing tasks such as emptying a drainage bag, what should a CNA do next? Option A, record that the task was completed. Option B, notify the family members. Option C, report directly to the medical director. Option D, disconnect catheter tubing. The correct answer is option A, record that the task was completed. Record that the task was completed. Question 490. Where can CNAs find a list of tasks they are legally allowed to perform? Option A, state laws and regulations. Option B, federal laws only. Option C, nursing home policies. Option D, a medical board guidelines. The correct answer is option A, state laws and regulations. State laws and regulations. Question 491. When a CNA measures urinary output, where should they document it? Option A, intake and output, INO, form. Option B, nurse's notes. Option C, doctor's orders. Option D, patient's chart. The correct answer is option A, intake and output, INO, form. Intake and output, INO, form. Question 492. After taking a patient's vital signs, the next step is to Option A, write them on a piece of scrap paper. Option B, call the family members. Option C, document them on the vital signs form. Option D, report them to the doctor. The correct answer is option C, document them on the vital signs form. Document them on the vital signs form. Question 493. When a patient is being discharged from the hospital, who often assists with planning their discharge? Option A, registered nurse. Option B, occupational therapist. Option C, social worker. Option D, dietitian. The correct answer is option C, social worker. Social worker. Question 494. Where is restorative care typically provided? Option A, acute care hospitals. Option B, hospice care. Option C, respite centers. Option D, rehabilitation units. The correct answer is option D, rehabilitation units. Rehabilitation units. Question 495. If a nurse assigns you to empty a patient's urinary drainage bag, what should you do? Option A, refuse the task, as it's not a CNA's responsibility. Option B, disconnect the catheter tubing. Option C, complete the task and report it to the nurse. Option D, kink the tubing before emptying the bag. The correct answer is option C, complete the task and report it to the nurse. Complete the task and report it to the nurse. Question 496. Teamwork in healthcare requires. Option A, equal collaboration among all team members. Option B, the doctor to lead the team. Option C, the nurse to lead the team. Option D, constant supervision by a senior staff member. The correct answer is option A, equal collaboration among all team members. Equal collaboration among all team members. Question 497. A sign of success within a healthcare team is when. Option A, conflicts are viewed as opportunities for growth. Option B, mistakes are punished severely. Option C, negative emotions are never expressed. Option D, team members avoid taking risks. The correct answer is option A, conflicts are viewed as opportunities for growth. Conflicts are viewed as opportunities for growth. Question 498. In a care conference, who is most responsible for the patient's care plan? Option A, the patient. Option B, the nurse. Option C, the doctor. Option D, the CNA. The correct answer is option B, the nurse. The nurse. Question 499. Who should attend a patient's care conference? Option A, only doctors and nurses. Option B, only CNAs. Option C, the entire healthcare team and the patient. Option D, only the patient's family. The correct answer is option C, the entire healthcare team and the patient. The entire healthcare team and the patient. Question 500. When documenting, a CNA is allowed to record. Option A, all patient care, including doctor's orders. Option B, only the care they personally provided. Option C, diagnoses from the doctor. Option D, lab results. The correct answer is option B, only the care they personally provided. Only the care they personally provided. Question 501. An OSHA survey in a healthcare facility focuses on. Option A, CNA certification. Option B, patient rights. Option C, nursing licensure standards. Option D, health and safety practices in the facility. The correct answer is option D, health and safety practices in the facility. Health and safety practices in the facility. Question 502. Most of the care provided at an assisted living facility, ALF, is delivered by. Option A, physicians. Option B, personal care assistants. Option C, registered nurses. Option D, physical therapists. The correct answer is option B, personal care assistants. Personal care assistants. Question 503. What is the first step to take if Mrs. Davis begins coughing and shows signs of choking while eating? Option A, encourage her to keep eating. Option B, immediately perform abdominal thrusts. Option C, stop feeding and allow her to cough. Option D, offer a drink to wash down the food. The correct answer is option C, stop feeding and allow her to cough. Stop feeding and allow her to cough. Question 504. Which of the following should a caregiver avoid when providing oral care to a patient without a gag reflex? Option A, using a suction device to remove excess secretions. Option B, ensuring the patient is positioned on their side. Option C, using a soft toothbrush to clean the teeth and gums. Option D, offering a sip of water to rinse the mouth. The correct answer is option D, offering a sip of water to rinse the mouth. Offering a sip of water to rinse the mouth. Question 505. A resident reports pain but doesn't want to bother the nurse. What should you do? Option A. Encourage the resident to tell the nurse. Option B. Notify the nurse immediately. Option C. Wait until your shift ends to report it. Option D. Ignore it, since the resident didn't formally complain. The correct answer is option B. Notify the nurse immediately. Notify the nurse immediately. Question 506. What is the primary goal of palliative care? Option A. Correct behavioral issues. Option B. Improve performance in daily activities. Option C. Reduce food intake. Option D. Provide comfort and relief from symptoms. The correct answer is option D. Provide comfort and relief from symptoms. Provide comfort and relief from symptoms. Question 507. If a coworker hoards linens, what should you do? Option A. Report it immediately to the nurse. Option B. Take the linens back when they're not watching. Option C. Address it directly with the coworker and report if needed. Option D. Ignore it since it doesn't affect your duties. The correct answer is option C. Address it directly with the coworker and report if needed. Address it directly with the coworker and report if needed. Question 508. If a resident not assigned to you requests assistance, what's the best approach? Option A. Report the request to the nurse immediately. Option B. Ignore the request since it's not your resident. Option C. Provide care, then notify the assigned CNA. Option D. Help if it doesn't interfere with your assigned duties. The correct answer is option D. Help if it doesn't interfere with your assigned duties. Help if it doesn't interfere with your assigned duties. Question 509. If a resident's family member inquires about the resident's medical diagnosis, you should: Option A. Answer to the best of your knowledge. Option B. Provide general information without specifics. Option C. Politely explain you don't have access to that information. Option D. Direct them to the nurse or healthcare provider. The correct answer is option D. Direct them to the nurse or healthcare provider. Direct them to the nurse or healthcare provider. Question 510. A patient who is on fall precautions is found attempting to get out of bed without assistance. What is the first action the CNA should take? Option A. Call for the nurse immediately. Option B. Reposition the patient and remind them not to get up without help. Option C. Assist the patient to a sitting position and offer assistance. Option D. Apply restraints to prevent further attempts. The correct answer is option C. Assist the patient to a sitting position and offer assistance. Assist the patient to a sitting position and offer assistance. Question 511. A physiatrist specializes in: Option A. Mental health. Option B. Rehabilitation. Option C. Neurology. Option D. Nutrition. The correct answer is option B. Rehabilitation. Rehabilitation. Question 512. CNAs are personally responsible for: Option A. Patient outcomes. Option B. Ethical actions. Option C. Administering medications. Option D. Diagnosing conditions. The correct answer is option B. Ethical actions. Ethical actions. Question 513. A patient with prolonged bleeding after a small cut might have a deficiency in which vitamin? Option A. Vitamin A. Option B. Vitamin C. Option C. Vitamin K. Option D. Vitamin E. The correct answer is option C. Vitamin K. Vitamin K. Question 514. Which nutrient is essential for calcium absorption and preventing bone disorders such as osteoporosis? Option A. Vitamin C. Option B. Vitamin D. Option C. Vitamin B6. Option D. Vitamin K. The correct answer is option B. Vitamin D. Vitamin D. Question 515. A patient has symptoms of fatigue, pale skin, and a sore tongue. Which vitamin deficiency might be responsible? Option A. Vitamin A. Option B. Vitamin C. Option C. Vitamin B12. Option D. Vitamin D. The correct answer is option C. Vitamin B12. Vitamin B12.